Good morning, everyone. My name is Rosemary Ohles. I am president of the Board of Directors of OpenSky Policy Institute. On behalf of the board and the staff of OpenSky, welcome to the 2024 Policy Symposium. How fitting it is that we gather today at this beautiful University of Nebraska facility Innovation Campus to inspire innovative policies and creative problem solving. We're going to take deep dives into some complex and critical issues facing policymakers in our state. We will hear from national and local experts on affordable housing, food security, and educational equity. Then conclude the day with keynote speaker Derek Black, a nationally renowned expert on issues related to school funding and the intersection of civil rights. By being here today, you have demonstrated the intellectual curiosity that has always been a common thread among Nebraskans of all political persuasions. It is why our state remains home to some of the finest institutions of higher learning, a top-ranked K-12 education system, and organizations like OpenSky, where thorough analysis, research, and rigorous exploration is central to our work to make economic opportunity a reality for all. Another common thread among Nebraskans is our commitment to serving our neighbors. We have several elected officials joining us today, from our local school boards to the state legislature. Will any elected officials, past and present, please stand and be recognized? Over there. Thank you for your service to Nebraska. Serving our communities also requires running for office. Will any candidates for office please also stand and be recognized? Thank you for your commitment to Nebraska. Throughout the day, I invite you to listen, take notes, and use breaks to engage with one another, learning more about the unique communities and backgrounds represented here in this room. Ask questions, propose solutions, begin the collaborative work of moving our state to higher ground. Working together is how we continue positive progress, and we are honored to work alongside you. And now I will turn it over to OpenSky's Executive Director, Dr. Rebecca Firestone.
Good morning, everyone, and thank you so much to Rosemary for your opening remarks. The work of OpenSky Policy Institute and events like today would not be possible without the guidance and leadership of Rosemary and her colleagues on our board of directors. I would ask our esteemed board members in the room to please stand. Thank you so much for all you do to support us in the state of Nebraska. I'm Rebecca Firestone, and as Executive Director of OpenSky Policy Institute, I have the privilege of leading a group of pretty serious nerds. In all seriousness, the team at OpenSky is passionate about many things, and chief among them is providing thoughtful analysis and policy solutions that elevate the good life. As a reminder, OpenSky Policy Institute is a 501c3 organization, and as such can take positions on introduced legislation and on issue advocacy campaigns subject to federal lobbying limits. Since the last time we convened this symposium, our team has navigated a 60-day legislative session, a summer special session focused on property taxes, unprecedented budget adjustments, a referendum on the repeal of a program that would direct state dollars to private K-12 schools, thousands of spreadsheets, one-sheeters, rotunda meetings, and strategy sessions. It's been a really big year, and we're just getting started. As Rosemary shared, we're incredibly excited to share a program with you here today that is thoughtfully designed to meet the moment that we are here right now in Nebraska. Today's symposium is designed to be informative and educational, ensuring that you have factual information with which to evaluate different policy options. We're in the midst of an affordable housing crisis that has left Nebraska 45,000 units short of the number needed to house all low-income Nebraskans, according to the National Low-Income Housing Coalition. Thousands of families are cost-burdened, paying more than half of their income to keep a roof over their heads. In a state that produces food, fuel, and fiber for the world, 1 in 5 children face hunger, which has a strong association with negative health outcomes over the life course. And we're welcoming Nebraskans from across the globe through immigration and resettlement programs, which are diversifying and enriching our communities, but also creating challenges for our public schools who have an obligation to meet the needs of a rapidly expanding population of English learners. We're navigating school funding challenges with far-reaching proposals imminent in the January special session, the regular January session. Sorry, I've gotten so used to talking about special session because that's been such a focus of our work for the past few months. With a public school system that ranks top 10 in the country, according to WalletHub, we are focused on accelerating equity and achievement while resisting a national push to direct state dollars to private schools, threatening state budgets in state after state without a significant return on investment. We're excited to bring local and national experts on all of these topics today, articulating the issue from all angles, providing insight and solutions that can help close the opportunity gap for families trying to access the good life while investing in the young people who will lead our state into the future. Indeed, there are many challenges facing our state, but there is also exceptional opportunity. Our unique unicameral nonpartisan legislature has shown time and again that we can do remarkable things when we work together. So how are we going to get there? We wanted to take a little bit of time this morning to share with you some key pieces of our newly crafted strategic plan for 2024-2025 for OpenSky Policy Institute, in hopes that we can count on you to work alongside us to achieve the lofty goals that we have outlined for the next few years. Our strategic plan launches a refresh of our vision and mission, which you can see here on the slide, with a real focus on advancing evidence-based policies that are going to drive economic opportunity for all Nebraskans to ensure that everyone in Nebraska can thrive. We're also excited to share the values that underpin this strategic plan, values of integrity, courage, equity, and our focus on being people-centered. And lastly, let me share with you our policy goals, a focus on a fair and sustainable revenue system, equitable outcomes-based K-12 financing, and a state budget for everyone. This gives focus to our research and our engagement with our partners to focus policy development. And if you want more details about the strategic plan and how we're aiming to get there, please take a look at the one-pager that's in your program to find more information. This strategic plan was developed in some robust consultation with all of our stakeholders and through partnership between the OpenSky board and our staff. We're really excited to get to work with you in advancing this strategy together. So Nebraska's affordable housing crisis has caused ripple effects throughout our state, with rural and urban areas facing unique challenges. It's critical that our state find a way to boost affordable housing to attract a strong workforce, drive the state's economy, and provide for the safety and security of our neighbors. We've asked policy experts to join us today to discuss how to navigate these challenges through innovative, sustainable, and effective policy solutions. Throughout the day, you can read more about each of our panelists and their backgrounds in your program, but for now, please join me in welcoming our moderator, Judy Pederson, OpenSky Board of Directors President-elect, and our panelists, Buey of Spark, Carol Bodeen of the Nebraska Housing Developers Association, and Mari Castaldi with the Center on Budget and Policy Priorities. Thank you.
Good morning, and thank you to all of you who are here to help us learn more and know more about this issue that we have in the state. Carol, I'm going to kind of start this off with you. We had a few questions kind of submitted ahead of time, so we've looked those over a little bit. Can you describe the landscape of Nebraska's housing shortage, the key factors driving it, and the factors that are kind of specific to the Nebraska economy and housing markets?
All right. Well, I can give that a stab with the amount of time that we have, but I think that one of the things that we can focus on first is that Nebraska is not alone. I'm sure all of you are aware, every time you open up a news feed or are at any sort of conference or, you know, any sort of maybe just conversation among yourselves when you're out and about, that housing and housing affordability is an issue. And I think at one point in the work that I do now, I think a lot of the work was just raising that awareness that affordable housing was an issue. And now that's not the challenge anymore. So the specific factors, I believe, for us, and probably most of you know, stems back to the recession and the financial downturn that we had back in 2008, 2009 area. And that really took a hit on our housing development infrastructure. We lost a lot of builders and workers during that time because it just, you know, a lot of people took some hits financially and just were not able to continue on. And then it didn't make sense in that type of environment to build housing and build projects without knowing specifically that there was an end user or a market for that. So on the single family side, you had, you know, houses were only being built for the most part if you had someone wanted to do a custom build. And that happened, I think, especially so in a lot of our smaller communities in the state. And so I think that's where it started. I think from an overall standpoint, the ever widening income gap between our low wage earners and our high wage earners. And so I definitely think that's a factor, obviously from a national standpoint and also from a state standpoint. And then you know, we were coming out of the recession and all of that, and had low interest rates, and I think, you know, obviously things were going well, and then we had the pandemic, and so that just, I think, I mean, I know we are all aware of the many issues that caused, but on the housing side, that was especially impactful because the cost of housing, the inputs increased anywhere from 30 to 50%. So our contractors could be bidding a project maybe for 130,000, and within a year that project would cost 160,000 or 200,000. And so it's very difficult to keep up with that type of volatility and great increases. And then, of course, our wages did not go up at that time, and unemployment went up. And so that problem was exacerbated. And then you had still not having caught up from the lack of supply that happened back from the recession. And I call it the perfect storm. I mean, it just resulted in the situation that we have now. And then now we have high interest rates and with the inflation and so.
Yeah, thank you. I agree.
So
Thank you for that. It's a very good overview. Buey, what factors are common in our neighboring states and the U.S. economy? Can you kind of talk a little bit about that? Buey, yeah. Oh, Mari was doing that? Okay, yeah, sure, okay.
Yeah, sure. So you're totally right that Nebraska is not alone in facing an housing affordability crisis. And I appreciate the sort of call out of housing affordability is really a factor of two different dynamics. It's rising housing costs, but it's also people's incomes not keeping pace. And nationally, we've seen between 2001 and now, adjusted for inflation, rents have gone up 25%, where incomes have only gone up around 5%. And here in Nebraska, that looks a little bit different. It's rents have gone up, adjusted for inflation, 10% over the past 20 or so year, and incomes have gone up 9%. But that's the median income. And as we know, there are many, many people living well below the median income. And of those Nebraska households who are at 30% of the area median or below, which like in the housing world is the shorthand for that is extremely low income. So if you hear me saying extremely low income, that's sort of shorthand for that 30% of the area median. That's about $22,000 a year. 3/4 of those folks are paying more than half of their income in rent. So what's common also in Nebraska is who's most impacted by the housing crisis. And the housing shortage looks the worst for people at the lowest incomes who can only afford a few $100s a month in rent to be able to afford everything else that they have to pay for. I would say like the other thing that Nebraska has in common with neighboring states and really across the country is just that there's an extreme shortage of federal resources to address housing affordability. When it comes to the federal voucher program or federal rental assistance program, there's only one sort of slot of rental assistance for every 4 people who would be eligible. So that starts to make that housing cost burden make a little more sense when you realize how inadequate those resources are. And that's true for capital programs like the low-income housing tax credit as well. There's just been a decline in federal funding, and Nebraska, like other states, is sort of left to fill in the gap and try to figure out how to put the pieces together, especially as the housing crisis reaches more and more households further up that income scale.
Yeah, great. Thank you, Mari. Buey, I think maybe this next one's for you, so we'll get the mic down here. What are some of the most important initiatives right now, either at the local or state level, to confront the Nebraska shortage? And what are some of the funding sources of those initiatives?
Well, first of all, thank God she got the past question. So great job on answering that. So for Spark, so I'm I lead an organization called Spark. We focus on capacity building and holistic development. And on the developers side, basically part of the challenges our developers right now are facing, especially when it comes to East Omaha, is the middle workforce income housing, which only allows for single family housing development. And it doesn't allow multifamily housing, whereas the rural, the rural fund also allows that. So I think that's a quick, easy fix that that the DED or the state can make that could profoundly impact emerging and aspiring developers. And if you're looking at aspiring and emerging developers, they're not putting together 5, 6, 7 lots for the economy of scale. They're usually doing 1, 2, or 3 lots. And that model could even work in the missing middle concept in other parts of our cities. But so that is one. The second thing I think that DED and also our state could do is, if you're not looking to expand all of the NAFT awards, especially because you're looking at receipts that are coming ahead rather than what you have right now. I think having a set aside for emerging developers in communities that are looking to develop in their communities that reflect their communities, it's a really important support for developers that are just starting out, that want to do a little bit of a bigger scale projects that don't have the resources or backing as large developers. So
Yeah, that's very good. Carol or Mari, do you have anything else you want to add to that?
Well, just to, oftentimes in housing and in all different words, we use a lot of acronyms. He was referring to the Nebraska Affordable Housing Trust Fund when he said NAFT. And so that is our longstanding state program for affordable housing. And that is funded through the documentary stamp that is a tax which occurs when property changes hands. And so since 1996, I believe, that act, the Nebraska Affordable Housing Act, has been in place. And so that has been one of our primary funding sources for developing housing in that 80% to 120% area median income. So kind of your upper lower income and moderate income. And so I think continuing to fund that or put state money into that fund and work on different ways that it can be used, as Buey was saying. Right now it's it's maxed out. They award out as much as what they are given in that fund. But I think continuing to utilize that, maybe get more money into it so that it can be used, as Buey was talking about, for the emerging developers, and maybe a statewide down payment assistance program.
Yeah. Mari, did you have anything else? Okay. All right. So we sometimes hear arguments that government intervention isn't the answer to economic development challenges like our housing shortage, and that we should just let the free market do its work. What's the rationale for state government to engage, and do you see any state policy solutions uniquely placed to be the right answer? Mari, you want to take that?
Sure. I mean, I can try. So I would
Okay.
say that there's definitely a role for government to make good policy choices when it comes to addressing the housing crisis. And one of the ways that I've come to think about this is actually through the lens of the market failures that exist in our current housing market. And one of those is that our housing market simply can't deliver housing that's low enough cost for people with the lowest incomes. Now, there might be some market failures on the income side too. We won't get into that. But if you look at the national level, the average extremely low income renter makes around $11,500 a year. And if we assume that 30% of that person's income is what's affordable to them for housing, that comes out to $286 a month. But if you ask the National Apartment Association, they would tell you that the average operating cost for a unit is $586 a month. And that's not counting the cost of the land, the cost of construction, debt service. That's really the cost of operating the unit on a monthly basis, things like property taxes, property management, insurance costs, right? So the market can't necessarily deliver housing on its own that's low enough for someone at that lowest income, which means that there's a problem that government intervention could play a role in fixing. The other reality, though, is that's not to say that government policy has not caused harm or issues in our housing market. Really, one of the primary roles that government has played, and particularly state and local government over the past several decades, has been to constrain the construction of housing, particularly as you were mentioning, multifamily housing or affordable housing. So, there have been policies to really restrict zoning to make it hard to develop housing that's more affordable, denser housing. The other role that the government has played is through creating and enforcing segregation and exclusion, particularly of communities of color, through redlining, residential segregation, some prime mortgage lending, and that has contributed to the disparities we see in Black, Indigenous, and people of color experiencing higher levels of housing cost burden, a greater likelihood of eviction and homelessness, right? So there's ways that the government can misstep in housing policy, but there's also a really important role that government can play to make sure that housing is available to all people, because we all need housing. Housing is the foundation from which people can thrive, achieve economic security, educational outcomes, health outcomes. So it's a necessity. It should be a right, right? So I think that that we have to kind of hold those different tensions of what the right role is.
Very good. Thank you. I'm gonna, oh yeah, I was gonna have Buey see if you wanted to jump in on that one too.
Oh, well, I'm more on the end of it's not one or the other. I'm more on the side, the market could do a really good job. What was it? With economic relief in those terms, but also there's a strong role for the government to play, especially now where we're, in Nebraska, what is it, 40,000 houses or like 40,000 houses needed in the next 30 to 35,000. I mean, in order to meet those numbers, definitely there's going to need to be some type of intervention in that. But also, I think the market-oriented solutions, like I mentioned earlier, the missing middle concept of encouraging encouraging emerging developers and small-scale developers to develop in landfills, or not landfills, but infill lots, is going to be an important part of that like solution. So
Yeah, thank you. Thank you.
And just to add, I
Okay,
think that I like to think of it as not necessarily, I mean, yes, they're housing incentives, but it's an investment by the state, because all of the things that happen around quality housing development are, you know, the jobs and just the overall economic impact that it provides. So yes, it's some government help, but I believe it's an investment in the communities as well.
Thank you. Mari and Carol, I'm going to ask you this. You can see who wants to answer first. Can Nebraska build its way out of the housing crisis? And what considerations at a state policy level are there for expanding rental assistance to support renters for whom ownership may be out of reach?
Yeah, so I would say that no, Nebraska can't build its way out of the housing crisis, at least not through construction and development alone. I think there are certainly ways that that increasing supply and investing in development of preservation has a hugely important role to play. And there could be ways to further even optimize how our affordable housing financing programs and systems work nationally, and probably here in Nebraska too, to better ensure that housing is meeting the needs of folks with the lowest incomes. But not to sound like a broken record, but when we go back to the folks who are most impacted by the housing crisis, we see that the housing shortage looks really different. So for someone at 100% of the area median income, there are 101 homes affordable and available to every 100 households. But when we look at people at 30% of the area median, there are 33 homes affordable and available to those folks. However, the people, the 70,000 or so Nebraskans who are extremely low income, they're living in housing, they're paying more than half of their housing costs. So they're one emergency away from an eviction or a housing crisis. They have a place to live. They just can't afford that place. And so I think there could be a really important role that an expansion of rental assistance could play to help keep people stably housed, to allow them to be able to afford the other necessities of life without necessarily having to increase, like to create a new housing unit for that person. And there's like an important role for increasing supply to play.
Very good. Carol?
Well, I think also we should highlight some work that the state has currently taken on. And back at the end of 2022, beginning of 2023, NIFA, the Nebraska Investment Finance Authority, put forth a strategic housing needs assessment for the entire state, and then the strategic housing framework. And this was signed off on by both the outgoing Governor Ricketts and the incoming Governor Pillen. And it was broken down into 4 different areas to work on when it comes to meeting our housing crisis. And yes, part of it is on development and building of all of that, but there are the other areas that go into it. The workforce solutions, working with our community colleges and that to in our high schools to increase the number of people going into the trades. That's all a part of it. Putting together toolkits and things that can help communities to work on these projects and deal with some of these issues within their own community ecosystem, and you know, using examples from other places that have done it, and then those people going in or providing a plan that another community can then duplicate or use. And so I think that the state is taking the right approach from that standpoint with the leadership of NIFA to deal with that, you know, we can't build ourselves out of it, but coming from a lot of different directions, we can maybe make a dent.
Yeah, great. Thank you. I just want to be respectful of time. And we did say if you had questions, we would open it up for questions and answers. We have a couple of questions left that were pre-submitted. But if someone has a question right now, we'll definitely just raise your hand. And it looks like Connie is circulating with a microphone.
Good morning. The largest growing segment of our population are 65 years old and older. And many of these people have 3 to 5 bedroom homes that they no longer need to live in. They only need maybe 1 or 2 bedrooms. And of course, the thing that the older people are faced with is if I sell my house for $350,000 and open it up to the market, I'll then have to pay $500,000 to go into a townhome or something of that effect. And a lot of our 65-year-old people in Nebraska can no longer afford to live in their homes because the insurance has gone up and the property taxes have gone up and they're living on a fixed income. But some of the zoning laws can be changed in our cities to allow what we call ADUs, accessory dwelling units, where I could build a 1 or 2 bedroom small place on my property and then either rent out or allow some other family to live in my 5 bedroom, 3 bathroom house. So I think this can be part of the solution as well. But I think there still needs to be work done on that. And the state is trying to enforce these zoning regulations that allow these ADUs. But of course, we understand that the cities do not want to give up their role in enforcing their own zoning laws. But I just wanted to bring that up as a possibility to help lower income, larger families be able to live someplace. Thank you.
I think that's very good. And I think one thing you just pointed out is that to get out of this situation, we're really going to have to do out of the box type thinking and open up our minds to some other solutions. Yeah, go ahead.
I really want to, what was it? I want to thank you for bringing that point up. Again, I mean, like right now, the city of Omaha is about to take on our 30-year comprehensive plan. We hadn't had a 30-year or 20-year, it's supposed to be a 20-year comprehensive plan. We hadn't had it, I think, for about 30 years or so. And part of that is to look over that built environment and all those policies that come along with that. So doing, I mean, like, advocacy is going to be one of the most important components, and this is the time that we really need to step up. As if there's any Omaha citizens, get involved in that comprehensive planning process. The city has done a wonderful job trying to engage the community, trying to engage everybody involved before they put together the policy that's going to impact us for the next 30 years. But the other addition to ADUs, I would say, again, going back, broken record, but having that missing middle concept, I mean, downsizing is going to be an issue. So the stock have to go up. If there are infill lots and things of that nature, especially in places, I live in Dundee, and if there are areas where we have small scale developers able to develop row homes or things of that nature, that might be part of the solution as well to help with that downsizing impact. So I think the stock really has to go up.
Thank you. I have a question there.
Yes, good morning. I had a question that you brought up when you mentioned our extreme low income folks who are in housing but are one crisis away. I'm also concerned about the quality of that housing that they are in. And in the past couple of years, we've seen units with, 100 units be shut down due to really uninhabitable conditions. And what are some policy initiatives that could take place to hold landlords responsible and accountable for making sure that that housing stock is in good condition? Because market forces would say, well, we've got only, I've got 70 other people who would take that house or that apartment if you want to complain about it. And so I think that really hurts the renter that doesn't feel like they can advocate for themselves and for better conditions. And so is there anything that the state can be doing to hold those folks accountable?
Yeah, I mean, I can try to answer. I don't know the state of play in Nebraska around sort of like interplay with states and localities and tenant protections. But like certainly stronger habitability protections and actual enforcement mechanisms around habitability play a huge role here. Just because a family is low income doesn't mean they should be relegated to substandard housing that, potentially harms their health. And I think that's another place where sort of intervention is really important. We've seen in the past couple of years stronger protections around things like habitability be enacted in states across the country. The challenge often becomes enforcement. But in the voucher program, this is actually a place where we see this exact issue coming into play, because in order for a housing voucher to be, matched with a unit, the landlord has to agree to have the unit inspected, and it has to meet those habitability requirements, which unfortunately often means that landlords don't want to take those vouchers because they actually don't want to be subject to that level of scrutiny. There may be other reasons and instances of bias that contribute to that too. But it is a place where we see those habitability concerns cropping up as well. I was part of a conversation here last night with some folks and talking about the importance of housing preservation. And on one hand, there's sort of the affordability side, making sure that housing that's been subsidized, that's reaching sort of the end of its required period of subsidization, is able to remain affordable. But there are also questions of when you have an aging housing stock or a stock that hasn't been kept up, how to kind of create opportunities for those issues to be addressed for households that don't necessarily have the income to be able to invest in huge scale renovations. I think that may be true for some landlords who may be smaller landlords who themselves are relying on rental income and don't have a ton of capital lying around to make improvements on buildings. There are also probably instances of where it's exploitative, where they're not investing what they should be in maintaining the property. So I think trying to kind of tease those things out and think about what habitability protections and enforcement look like is a really valuable thing to think through.
Yeah, thank you. The worst thing that can happen is that they get evicted, because then that's on their record. And then going forward, it's a huge issue. So as much as we can avoid that. There's a question in the back. Oh, Connie's there. Okay.
So with the shortage of housing and therefore a lack of competition, do you see a problem with landlords arbitrarily raising rents just because they can? And then to me, that would be causing even more of a problem. And do you see any solutions if you think it is a problem?
Well, I mean, I'm going to pass this on to Carol right afterwards, but I could say from personal experience, my father lives in North Omaha right now, and he's lived in that house. We rented that house for about 15 years. Unfortunately, my mother passed away 2 years ago, and their rent was about $750 a month, and just a year ago went up to 900 and something a month. And that made it difficult. And kind of piggying back to the earlier discussion, one of the things he didn't want to bring up with his landlord is he did not know if he was going to get evicted or not. He didn't want to ask too many questions because he's lived there, he's made a community. So one of the things we talked about is how do you advocate through the community? Because I'm an immigrant, my father is an immigrant, so we're an immigrant family. A lot of the disconnect is we don't know how to communicate with the city. We don't know what to go through the channels. Now, that's not to say our city isn't doing a good job of reaching out to us. In fact, I think over the past few years, they've made an extraordinary effort trying to get into the community and understand what's taking place. But I know for my father and my family, the disconnect has always been, we didn't know what channels to go through. But then the fear comes in is if you poke the bear too much, you know, you might end up in the street situation. Fortunately for him, he has 5 sons now that could take him in. We just don't want to right now, but so.
Well, I don't know what more I could add to what Buey said. You know, I think that there are obviously going to be parties that take advantage of situations, and if they see that they can raise rates, they may, but I'm sure that there are also those out there that you know, are not going to take advantage. But
Yeah, I live in North Platte, and we have a beef plant that's coming to our area, and we're a couple years away from having a lot of people move into town, but we're already seeing that happen with the rates going up on existing properties. So it's something we're aware of and trying to figure out how to address that for the people that live there that can't afford that increase. So that's a good question. Any other questions? And we can, I'm not seeing any right away. There's TIF. Well, we'll start with TIF here. Is one of Nebraska's most powerful municipal finance tools. How is TIF working for expanding access to affordable housing? Where could it be improved? And are there some other municipal finance tools that Nebraska could think to support affordable housing?
well, first off, I want to make note that we were offered the opportunity to look through these questions, and people volunteered as to which questions they wanted to take, and no one volunteered to take on TIF. So, anyway, I can make some comments though. If you're not familiar with tax increment financing, it's a tool that is legislated, and just to make it as simple as possible, it's using the increase in property taxes from a project to basically pay off part of the costs of the project in the form of bond financing. And so and oftentimes in housing development, which is where I'm more familiar with it, it's used for infrastructure. And so when you're putting in a larger scale development, as you know, the cost for the developer, one of those huge costs is the cost of, you know, streets and utility connections and all of those things. And so that then has to get factored into the cost of the development, whether it be the cost of a lot that is sold or just the overall base cost of the construction. And so then that has to be passed along, you know. And so by using that TIF financing mechanism, that can allow that project to happen more easily. So it can make it a little more affordable for the developer, and then ultimately more affordable for the end user. And it can be argued that that infrastructure really is an investment in the community long term, because you know, the people who are living there are those taxes, you know, maybe a period of time that that tax increase is deferred, but ultimately those higher taxes are going to come back to the local municipalities and counties, and that the deferment, it was hopefully enough of an advantage in getting that infrastructure that is a part of that development, that is a part of the increase in ultimate property taxes. One of the big challenges of TIF, and especially in the housing standpoint, is that the land, the area must be declared substandard, blighted, and in need of redevelopment. And so if you're trying to put in a housing development on the edge of town and you want to get an area declared substandard or blighted, you can imagine that anybody who owns property around there is not going to be very happy with it being talked about that their general area is considered blighted or substandard. And so that can cause problems when a developer is working through the TIF process. So,
And that is language from the state statute, isn't that
yes,
correct?
yes,
Yeah.
correct, correct.
Yeah, I'll add for our developers, because we work with emerging and like I said, small scale and emerging developers. Any one of these government subsidy, or whether it's on the municipal side or state side, city, one of the challenges is scale, because our emerging developers may not have enough land to be able to make these to be able to make these incentives work. So it becomes a barrier. I think that's one thing we need to consider, especially with small scale and emerging developers, putting together the economy of scale to make these government subsidies work at times start becoming a barrier. And I'm not just talking about Omaha. I'm talking about, whether you go look at Valley, you look at Beatrice, anywhere there's housing need in our state, if you're looking at small and emerging developers, unless you could make that economy of scale work, those incentives, light tech, any one of those become difficult to make work. So I think that's one thing we kind of need to consider in this is small and emerging developers, the entrepreneurs of our state.
We talked, oh, go ahead. I'm sorry, Rosemary. Joey's on his way.
Before we leave the topic of tax increment financing, just in this morning's newspaper, I don't know if the Lincoln Journal-Star had an article about Foxtail Meadows, which
Yes.
seems to be a successful, it's not far enough along to know whether it'll ultimately be successful, but the early reports seem to be that that's a successful way to leverage tax increment financing to help from the middle, not so much the lower end, but it seems to be a good strategy for so mixed use townhouses, different levels of income. Would you comment on that?
Well, I was actually at that ribbon cutting last night, and we're a membership organization. And so many of our members in the affordable housing development realm were a part of that project. And I was talking to the developers and telling them that I am going to use this one as an example of how these projects can come together. They used as much as I can think of, they used every single method of financing and developing a housing project. They used state and federal low-income housing tax credits. They used the Affordable Housing Trust Fund. They worked with Habitat for Humanity. They, let's see, what all else? They worked
in the national one, the National Housing
and the
Trust?
National Housing Trust Fund. And they worked with one of the things, and when we were talking about additional mechanisms, and Buey can kind of talk about this, but they also use community development finance institutions as well. So CDFIs, which Spark is one of, and so that was utilized, local banks. And that is going to be developed. There's going to be income levels all the way from market rate down to 30% of area median income in that project. So.
Yeah, that's very good. Do we have any other questions out in the audience? Okay. All right. So if you could wave a magic wand and change one state level policy that would unlock the ability of your organization to address the housing shortage, what would it be?
Well, encourage small scale developers, specifically, I guess, in for Omaha is that, like I said, allowing the middle workforce income housing to include multifamily. So,
okay. Carol, what do you?
If I could wave the magic wand.
Wave the magic wand to change one state level policy.
Oh my. Can I just say I would double the funding for the Nebraska Affordable Housing Trust Fund and the Middle Income Workforce Housing Fund and the Rural Workforce Housing Fund. So if we could just double it. That'd make me happy.
And then we also have to allow the legislature has to allow for the DED, Department of Economic Development, to spend at that level. Because sometimes the money comes into that fund, but they don't have the ability to spend all of that money. So then some money accumulates in the fund, which looks like it's not being used. So we need the spending authority and doubling it. So we actually have two there, so sorry. All right, Mari.
Well, since I'm not from here, I feel like it's easy for me to say, but I would cultivate a really robust and equitable revenue stream to provide ongoing funding for rental and operating subsidies. I think particularly for some of the development that is happening, to create a source of ongoing operating subsidy, like a project-based subsidy that can actually index rents to the incomes of tenants rather than some kind of theoretical person at a certain income level. It could go a long way to opening up new supply for people with the lowest incomes.
Yeah, that's very good. Okay, I think we're pretty close to being at our time. So if we don't have any other questions out in the audience, oh, I'm seeing one. Okay, Connie's on her way.
One other problem we have in our state, especially rural, is nursing home, assisted living facility homes, and other countries are doing things. And because it's so hard in the rural areas to recruit and retain workers, what other countries are doing is they're allowing students free rent at the facility to help take care of the residents in that facility. So therefore, the students become it's like family to them. And so they get rent free to live there, but then not only do they go to school, but they spend 30 hours a week taking care of the residents. So again, we need to be creative, I think, in doing these kind of things because a student only needs a 1-bedroom apartment while they're going to school anyway. So anyway, thank you.
Yeah, that's very good.
Appreciate naming that. And one other thing to keep in mind, and something that we're seeing states doing, and this is across red states and blue states, is really actually tapping into Medicaid as a resource to fund housing related services, including home and community-based services for older adults, people who need support with like activities of daily living. And through some waiver authorities in Medicaid is fairly recently able to pay for housing navigation services, tenancy support services, services that would be provided in a medical setting to be provided at home, and can even pay for up to 6 months of transitional rent payments. So that's something to think really carefully about, because that could be unlocking a huge federal funding stream to support particularly folks who have more services needs along with their housing.
Yeah, that's very good. I do know, and it's not a good thing to have those facilities closing, but I do know that there's an effort in some of the small communities like Curtis and some of those places where they're going in and they're doing tax credit projects to turn those facilities into housing. And so, again, we have to use all different types of things. We don't want to displace people to put other people in, but at least it's better than sitting empty. But yeah, definitely good information to have. So I think if there's no other questions, I want to thank our panel. They did a great job. Please thank them.
All right. Thank you so much to everyone. All right. We've heard a variety, I think, of different concrete policy options considered this morning, from expanding several of the funds available to invest in housing in the state, thinking about the sustainable revenue streams, of course, will always be a key challenge, and a way of mixing different finance mechanisms to be able to create robust, impactful developments and addressing both our supply of housing as well as ensuring the habitability and the affordability of housing. So Thank you.
I'm
to
here.
our
So
panelists. And
next
now
up,
we're
we
going
will
to
be
shift to another pressing issue for Nebraska families and explore food security, especially through the lens of how a lack of affordable, healthy food can have a ripple effect on an individual's individual health and well-being. Implementing evidence-based policy related to nutrition access can be a long-term preventative investment that actually reduces state expenditure. Our panelists will explore the concept of food is medicine, potentially a key investment in a healthy, thriving Nebraska. Please welcome our moderator, Senator Jen Day of Legislative District 49, our panelists, Alicia Christensen of Together, Hollyanne Fricke of the Center for Nutrition and Health Impact, and Trina Ragain with Eccentricity Consulting. So thank you so much for being here.
Good morning, everybody. I'm Senator Jen Day, and I am excited to moderate this panel here with some very distinguished and knowledgeable guests. This is an issue that has always been close to my heart as a health and wellness professional previous to being elected as a state senator and working on food insecurity issues as a senator myself. I'm excited for the conversation today, and I hope you all are as well. So first, I will start with Trina. Can you briefly explain what the Food is Medicine initiative is, how it came about, and why it is important in addressing food insecurity?
Sure. Good morning, everyone. So I am the earliest program I know of started in 2009 in terms of looking at food as medicine, specifically through a healthcare lens. What you'll see up on the screen is sort of the accepted pyramid of food as medicine interventions, starting at really the environmental level with overall policy change towards the bottom, and then working its way up to very specific medically tailored meals that are used when treating very specific health conditions. Think renal disease, heart failure, something where your outcomes are going to be impacted by things like how much sodium you're intaking, how much protein you're intaking, things like that. And so this is an open source article. It's only 2 pages. You have this graphic as well as a table that outlines each of them and kind of what's included according to what I consider like the czars of food as medicine, those who are working on this at the national level. So I'll encourage you to download this article. I'm a child of the 90s, so I brought printed copies if anyone would like one. I have a few at my table that I'm happy to share. But I think it's a great short overview of how most practitioners think about food as medicine now. This is a really kind of cemented way to think about it. And the reason that this is so important that we have this model of how we're thinking about food as medicine is because of the policy work that's being done to advance food as medicine on a national and a state level right now. Because we all need common definitions of what we're talking about when we say a produce prescription program, or if we're talking about medically tailored groceries, or if we're talking about a medically tailored meal. We all need to be using that same language and understand what we're talking about. And so this has really distilled down almost 15 years of research to look at what type of programs have people been doing, what sort of health conditions have they been addressing, and then what sort of outcomes can we anticipate. And so I think this gives you a good idea, starting at the bottom more broadly on policy change and working up to very specific populations of how food as medicine can really impact almost everyone, right? So we are what we eat. We've been saying that for a long time. There was I believe a Wisconsin journalist, and he said, if vegetables taste like bacon, none of us would be talking about this at this point. And I think he may have had a bit of a point there, but this is the accepted model. So I think it gives you an idea of how people are thinking about these programs. And when we look at creating policy through healthcare reimbursement, which is really the model that we're moving towards for this, how we're speaking about these.
Thank you, Trina. And the second half of that question I would ask is there any federal funding available for the Food is Medicine initiatives?
Yeah, so I think I can speak very broadly to this, and then if you want to talk a little bit about specifics, we can do that. Yes, there is federal funding. So we really saw a lot of interest at the federal level start in 2022 with the president convening the first conference on food and health and food insecurity, and I can't remember the exact title. Food and hunger. See, we don't remember. So, but it was very, lots of buzzwords, but it was the first time in 50 years that the president and at the national level, they really brought experts together to talk about this. And it was the impetus for both public and private commitments to looking at both nutrition security. So, there's food security. Do we have enough to eat? There's nutrition security, looking specifically at what there is available to eat. And then also looking at from the health perspective of this. And so through this conference, it's really, I think, elevated the issue at the national level. There is national legislation to fund medically tailored meals. I don't think it's passed as of yet. It was introduced out of Massachusetts by Representative, I can picture him in my head. Never mind. But you're also seeing guidance come out. I called it a love letter to the Medicaid state directors that came out from the Center for Medicaid and Medicare Services. And that was, it's time to invest state Medicaid dollars in addressing social determinants of health, including food security and food is medicine. And so it was like this 53-page document of how they could, with the federal government's blessing, start using state Medicaid dollars to address food is medicine as part of their programs. There's tons of grants that come down. There's research grants through NIH, there's CDC funding. There is just a variety of funding mechanisms at the federal level, as well as some that we maybe will talk about in terms of seeing healthcare systems and Medicaid managed care companies investing in this throughout the country. And there's some specific examples I think you can give.
Sure, yeah. My work is predominantly kind of in the middle of the pyramid with the Produce Prescription Program, so I can speak directly to that. And there is a robust federal funding through the USDA since 2019, the Gus Schumacher Nutrition Incentive Program, or GUSNIP for short, which was appropriated initially in the 2018 Farm Bill. Previously, the Healthy Incentives Pilot out of Massachusetts and the FINI program funded nutrition incentive programs across the country, and the 2018 Farm Bill and then the 2019 GUSNIP funding added produce prescription projects to that funding mechanism. So going into the 6th year of funding for produce prescription projects through that funding mechanism. And just going back to kind of the second part of the initial question in terms of why these types of programs, including produce prescription projects, but all the programs on that pyramid are important in addressing food security, I think, and we'll talk more about this throughout the panel, is that we know, food insecurity is linked to poor dietary quality, and we know that poor dietary quality can contribute to risk of chronic disease or developing chronic disease. So food is medicine initiatives are, I think, really important in both preventing and sort of stopping stopping them from getting worse. We know they can be preventive. They can sort of, prevent them from getting worse and reduce healthcare costs, which we're going to talk more about as well. And I think it also recognizes that nutrition is a social determinant of health, which we'll get into a little bit more as well. Okay.
Okay, so that's a great segue into my second question. Hollyanne, I'm going to direct this at you. How can a prescribed diet act as preventative care for those facing health issues, be at risk of heart attacks or being pre-diabetic?
Sure. You started to address it a little bit, but I think these types of programs and intervention allow us to really directly address the dietary factors that contribute to the onset and progression of disease. So just as one example, for folks that might be
pre-diabetic or diabetic or at risk for developing those things. A diet that limits refined sugars and carbohydrates may prevent them from needing insulin or may help them be on a lower dose of a medication and just sort of prevent the spread of that. And there's, of course, countless other examples, hypertension, heart disease, et cetera, diets that could address those things specifically. But I think the other important piece of that is not just addressing the diet, but making sure that there's those sort of wraparound services that go alongside that. So a couple that sort of come to mind is transportation. So making sure that folks actually have access to get to wherever these programs are going to be operating or wherever they're, picking up the meals or the fruits and vegetables for the prescription. And then the nutrition education piece is huge as well. So making sure that they have the right equipment, that they know how to cook the foods that are part of these programs so that it's sustainable beyond just, the 6 months or 12 months or what have you that the program is operating for.
Thank you. And Alicia, I'm going to send this question to you. And then obviously anything you have to add, please feel free. Can you talk about the potential value of investing in nutrition and how it can contribute to cost savings in other areas of healthcare? Nebraska's current SNAP eligibility level, a gross monthly income that is 165% of the federal poverty level, is set to sunset soon and fall back to 130% of federal poverty level. What would the implications be for people to lose their SNAP eligibility? That's a lot. There's a lot in that question, but yeah.
Well, I think the sort of first question about how this translates into cost savings, I think to state the obvious is that if you have a less severe case of your chronic illness or you can prevent it from occurring at all, then obviously that is going to decrease costs significantly. Generally speaking, the people who are most vulnerable, those with the least resources, are the most likely to have these chronic conditions. They're least likely to be able to afford the healthy choices. So programs like SNAP is part of a larger ecosystem of addressing these health-related social needs. So though a person on SNAP might not qualify maybe for a fruit and vegetable prescription, having SNAP benefits allows them to still purchase produce, double up food bucks, helps them double the amount that they can spend on fruits and vegetables. And that is part of having that person not progress to the point where maybe they need a food and vegetable prescription or medically tailored meals. So these don't work in isolation because it puts too much burden on any one program. And then going in the other direction, those who say then earn too much, if the SNAP gross eligibility income limit sunsets, that then shifts that burden downstream to emergency food providers. The food banks in Nebraska have estimated that about, I think, 2.7 million individuals will visit emergency food providers this year in 2024. And that's up significantly from about 1.3 million about 5 years ago. So we haven't returned to pre-pandemic levels of traffic at food pantries. And that is straining some capacity for those providers. So it's about all these systems. Each of these systems address like a certain gap, a certain need. And when you shift too much of the burden onto any one of these areas, it puts everything out of balance. And then the providers don't have enough resources. The people in need don't have enough resources. So adding the food as medicine part in takes some of the strain off of the healthcare and our healthcare costs and Nebraska Medicaid, and sort of keeps spreading that burden, not burden, but for lack of a better word, around to make sure that everyone's needs are adequately met. And I think it also does, you hear those, we're up here with the old like adages all over the place, right? But like keeping the apple a day, like if you do work on prevention, an ounce of prevention is worth whatever, something else. And there's a whole bunch of adages about this. We're like, prevention is better. It's cheaper. It's better for the person's long-term health. If you never get diabetes, it's better than getting diabetes and then treating it. even effectively. So the idea that you can save money by preventing it is because those treatment costs are higher than the prevention costs. So what it gets squishy is that it's kind of hard to quantify that in like, because those costs come out in different ways. So you might see it in higher dropout rates for children who don't have enough to eat and who face developmental lags. You might see it in other, higher crime rates, or, these things come out in different ways, but you pay for them some way. So I think it's a good way, a positive way, proactive and a productive way to handle those kind of issues that we all are going to face and are going to cost our communities money no matter what. So I guess that's, and I just would mention too, on the sunsetting specifically, I think what's interesting is that many don't realize that there's sort of 3 tests for SNAP. There's an asset test that you have to have less than $2,750, like checking, savings. In some states, they count your vehicle, the value of your vehicle. They don't count the value of the home that you live in, but if you own other property or things like that. So if you have less than $2,000 to your name, say, then you go to your gross income limit. And right now that's 165% of the federal poverty limit. For a family of 4, federal poverty limit is about $31,000 per year. Sorry. And so that puts 165 around $50,000 per year for a family of 4. And so the difference, that's 165. The difference is, I think 130 is around this is too many numbers, is $40,000. So it's about a $10,000 difference if that were to sunset. And so what we're talking about is that accentuates that cliff effect. So someone who might get a promotion, who might be able to pick up extra hours, the trade-off is really high to take that extra 25 cents an hour and lose $200 worth of SNAP benefits for your groceries each month. That might not compute for many families. So it exacerbates that cliff effect. And I think it kind of also neglects to take into consideration that everyone still has to meet the 3rd test, which is your net income cannot be higher than the federal poverty limit. So even at 165% for gross income, you still have to be around $30,000 net income to qualify for SNAP. So it's not opening a floodgate where we're at right now. It obviously works well for our systems. And our emergency food providers are worried about filling that gap then if that would sunset, because that would be a lot more people that would come through the doors at Together and the other food pantries in our communities. Sorry, that seemed extensive. I hope I covered everything. Yeah.
It was great. Thank you. If it's helpful, I can add a real life example of cost savings from one of these programs. So I spent 5 years at Operation Food Search. They are a nonprofit hunger relief organization in the St. Louis region. And we created a food as medicine program specifically for pregnant women who were getting their care through the state's Medicaid for Pregnant Women program. And the reason we did that, and we worked with Washington University in St. Louis to evaluate that and found a health economist to help us try and figure out the dollars and cents of this, right? And so we knew that a healthy diet contributes to having a healthier pregnancy and having a healthier baby. I used to refer to it as a twofer, right? Like you are providing food to one and you're impacting 2 health outcomes there. We weren't able to look at some of the long-term outcomes. So developmental delays associated with preterm birth or something like that. That would have to be a very long-term evaluation, and it just wasn't something that we were able to do. But we wanted to be able to go to our state legislators, to our director of MoHealthNet, our Medicaid department, with some real numbers in terms of why they should start investing in food as medicine in Missouri. And so we did a pilot of this program. It falls somewhere between like medically tailored groceries, I guess is where I would put it. This was before this pyramid existed. What we did was we provided meal kits to families. And so it was enough for them to make dinner for their entire family for 3 meals a week. it was the equivalent of $50 in groceries, because before the pandemic, when we looked at the SNAP gap, so the gap between people's SNAP benefits and what they needed to actually eat all of their meals every week, it was about $50 of food that they were lacking per week. So our goal with this Food is Medicine program was to fill it with $50 of nutritious food for households that were essentially growing families. And we had 75 pilot participants go through this program. We were able to work with our Medicaid managed care companies in Missouri, and we were able to compare their outcomes to the outcomes and costs of women in the city of St. Louis who were not receiving the program. And so what we found is most significantly low birth weight. Births decreased. So in our sample of pilot participants, we had an 11% low birth weight rate. When we looked at just those who were not in our program but receiving their care through Medicaid, it was at 16.3%. So using Medicaid data, we were able to extrapolate that if this was offered to every eligible woman in the city of St. Louis, just on that one health outcome, it could save them $5.3 million a year. And that wasn't looking at any of the other health outcomes in terms of trying to quantify that into a dollars and cents savings. And so that was one of the conversations we were able to have with the elected officials, was around how nutrition is cheaper than a day in the NICU, right? There's no amount of food is pretty expensive these days, but there's no amount of food I can provide that is going to rival a baby spending a night in the NICU. And that was the kind of conversation that helped us start making headway in terms of their interest in food as medicine as something that the state should pay attention to.
Great, thank you. Okay, so next question I will direct to Hollyanne. What does it mean that nutrition is a social determinant of health, and why are these social determinants important to address?
Sure. Yeah, I think we've all touched a little bit on this, but social determinants of health broadly are kind of the non-medical factors that influence our health. So things like where we live, where we work, the access to food that we have, and then ultimately what we're able to eat because of that food access. So again, just sort of re-highlighting something I said in the beginning, and I think that all of us have said, lack of healthy food access, we know can lead to poor dietary habits, and we know that poor dietary habits can contribute to risk of or diagnosis of diet-related chronic diseases. So that's kind of why nutrition is a social determinant of health. And what was the second?
Why are these social determinants important to address?
Yeah, I mean, I think lots of things that have already been said around, the opportunity to reduce health disparities and promote health equity, sort of reduce the burden on our healthcare system, improve quality of life, not just around diet, but just overall quality of life of the folks that are participating in these programs.
I was just going to add that I think there's been a lot of research on the topic, and I think that social determinants of health have been generally, there's kind of a range, but I would say 40% of health outcomes are driven by socioeconomic factors and social determinants of health. And that is outweighs other factors that include clinical care. That includes health behaviors like exercise and whether or not you smoke. That's the kind of weight that social determinants of health have on your health outcomes. I mean, it's kind of shocking, I think, to some extent, because I would never have believed that they outweigh those healthy behaviors, for instance. But it just touches every, portion of your life, and really just, I think, has a cumulative effect.
So Alicia, I'm just going to ask you an extra question. I hate to put you on the spot, but I'm going to.
No,
I'm interested. I have a hearing to put a little plug in for my own interim study next week on social determinants of health. But just to give us a bigger picture on outside of nutrition, like give us a few other examples of what are social determinants of health.
So it encapsulates the conditions that you live and work and play and age, and just how where, I don't know, all the things about your life. So it includes education. So that directly affects not just your income, but whether or not you have your employer's insurance coverage, or who you know, if you have a good connection with a great osteopath. Is that a thing? That sounds fake. It sounds like a like an aura doctor or something. Like, okay. I don't know why that's what came to my mind first. Pediatrician. Let's go with that. Let's pretend I said that. Okay. And it also encapsulates your neighborhood that you live in. So is there a high crime rate? Are you likely to be injured in your home because the housing stock is in poor condition, or have lead in your the soil in your yard, if you are in a place that has been redlined. And there's also things like, let's see, if you are in a community, so, the housing opportunity, like the last panel was talking about people not wanting to move out of their communities because that's their social connections. That's the person that can give them a ride to church. That's the person that shows up when they are sick with the casserole. And so all these different things, whether you have access to a playground or clean air and things like that, these all add up. And so I think when you think about it that way, I think that then that 40%, that influence of social determinants of health makes a lot of sense. And those are the broad ones. And then health-related social needs, just to be clear, are if someone's social determinants of health negatively impact their health, they have that health-related social need. So that's kind of the distinction between the two. They're sort of used interchangeably sometimes. But so when you're talking, social determinants of health can be positive. I live next to a park. My air is super clean. And I have a great education. But so they can be positive or negative. But the needs are the part or social risks are what we're talking about when we're saying that they influence poor outcomes.
That's great. Thank you. Yeah, go ahead.
I think you started to touch on this, but just wanted to add that, a lot of times, a lot of these social determinants of health are interacting with each other. They're not operating in isolation. And so they can just sort of compound and become, put someone even more at risk than they were with just sort of one negative social determinant of health. These really just compound. So for instance, if you, live in a neighborhood that has been, not invested in, don't have access to an actual grocery store, it may just be corner stores that only have, ready to eat foods, don't have fresh fruits and vegetables, all of that just sort of compounds. Yeah.
Great. Thank you so much. All right, Trina, I'm going to skip to a question for you here. How might Nebraska benefit from a food is medicine initiative, and what is currently being developed?
So I don't know. I am from St. Louis, Missouri. I've worked across Missouri, Kansas, Oklahoma, and a little bit at the national level. So I'm not sure what is happening on the ground in Nebraska right now. I think I've already mentioned one of the biggest opportunities for Nebraska, and that is the chance to modify your 1115 waiver to account for spending some of your Medicaid dollars, addressing the social determinants of health. I believe in the last panel, there was a discussion about the fact that it can cover up to like 6 months of transitional housing. Same thing for starting to screen for food insecurity and starting to provide some level of intervention for those that qualify. The leaders across the country, if you want to look at those who are really states that have really embraced this, Massachusetts was kind of first on the scene. Congressman Jim McGovern, that's whose name I was trying to think of before. North Carolina, California, there's an option called in lieu of services. There are states, so we have a few holdbacks on why this isn't currently reimbursable yet. So I'd say that's where Medicaid's, or that's where one of Nebraska's key opportunities lie, is in utilizing your Medicaid dollars to address this. I think there are other opportunities in the state. One of the really interesting conversations that we've had in Missouri, and it continues, I'm meeting with some farmers next week, is how does the regional food system and the regional food economy play into things like produce prescription programs, right? So how can this, one of the conversations we were having with legislators is, how can this be a win-win? So if we're going to put Medicaid dollars into purchasing produce for people in Missouri, for instance, how do we incorporate this kind of closed loop where we use our regional food system to then take those dollars and put them in the pocket of our farmers and our food producers? Because we know farmers are struggling, right? It's hard to own a family farm. And I think you're just as agrarian here in Nebraska as we are in Missouri. And so there's some opportunities to look at how you bolster your rural communities, how you bolster your regional food systems, and still kind of meet people's healthcare needs by providing them with that fresh food. So I think there's some really great conversations to be had, and people are already, I have found that like engaging with the legislature, engaging with MoHealthNet, like your Department of Ag, they want to have those conversations, right? Like, how can you keep more of the food that you are producing here to feed Nebraskans, right? I had a United Healthcare staff call me out of Kansas, and she said, I am working with this national company who provides produce prescription boxes. Did you know to get it to rural Kansas, I have to pay almost $50 to ship $50 of food? And my thought was, number one, where is that food being grown? Is it coming from Kansas? Who knows? But it was going to Tampa to be boxed up by a company that was then going to overnight it back to the middle of the country where it was being produced. And that's one of those things where I thought, like, we need to think a little bit more about local solutions. There are some large corporations out there who really see an opportunity to seize the moment right now. We're talking about billions of dollars in medical and in healthcare funding coming down, right? Through Medicare, you can already spend some of your dollars towards providing food security. We know it's coming for Medicaid. And so we have corporations out there who are trying to figure out how to capitalize off of these new reimbursement structures that are going to be coming down, I would guess, in the next 3 to 5 years. So they're investing a lot of money in trying to figure that out. And I think this is the perfect time. There's not going to be a better time to have those conversations locally and at the state level of how you can sort of own these types of interventions and really help them benefit your state economy and the people who live here.
Thank you. Do you have anything to add, anybody? Alicia? Maybe just about what if you know of anything that's happening here in the state of Nebraska yet, or
not government, not like Medicaid funded. I'm guessing, I'm not familiar with the funding sources for the projects that I know of, but I think one illustrative example is Whispering Roots in Omaha has partnered with Charles Drew Health Centers and the Creighton University to provide a food pharmacy program. And their program, so it's sort of the through line begins at Charles Drew. So eligible patients, which are people with a certain blood sugar level, diabetes patients, can be referred to this food pharmacy program. They attend classes at Whispering Roots once a month. It's a year-long program, and they get sessions on stress management, physical activity from Creighton University. And I think that they're also sort of mapping the outcomes, because I think that's a big part of any of these pilot projects, is to be able to track, like you did with those, Trina, like what kind of health cost savings and things like that we're seeing. And then they get their food prescription, and then Whispering Roots has a cooking class to show them how to make meals with what they've been provided. And you touched on this earlier too, that education component is really a key part, and that having people understand that how to prepare them, how to make them taste delicious, because it's not bacon, and how to then when they're on their own in the grocery store, which things to select, and to know even, is this ripe or is this about to go off, or, should I buy this or not? I think those are like crucial questions that not everyone has somebody that, they know how to knock on the watermelon in the right spot to know if it's ripe or not, which is a key skill. But I think that, so that education piece is a part of it as well. And I think that that's something that you'll find in the Medicaid waiver authority allows for nutrition education, and also cooking pans and a spatula and things like that, that you might not think of, or like people might not even be able to prepare the food even if they could afford it. So some of those just logistical items are also covered under Medicaid as well.
Great, thank you.
I'll just
Go
add
ahead.
really
Yeah.
quickly that, I know that there is not currently a GusNIP funded produce prescription project in Nebraska, and it is a priority state for USDA that they've identified in the last couple of requests for applications. And there are other models, other GusNIP funded programs in the Midwest. We have a map on our website of all of the active projects, and like everything around Nebraska is colored in. We've got Colorado, South Dakota, Iowa, Kansas, and Missouri. So I think, lots of folks would love to see Nebraska get colored in on that map and get that funding.
That is a great segue into my last question here really briefly. So we have a couple minutes left for questions from the audience, if we have any. Hollyanne, what are examples of success and what are some of the challenges facing the Food is Medicine initiative across the country, particularly in the Midwest?
Sure. Yeah, I can start with a specific success. So the organization that I work for, since 2019, when the GusNIP program began, has been sort of evaluating the national impact of produce prescription projects on the participants that are part of them and the communities that they serve. And something that we have seen annually in the impact findings reports that we're putting out is that longer participation in these projects, meaning, most of these folks are assessed at baseline. So when they begin the program, and then again at the end of the program, and in some cases, other points along the way, they're seeing an increase in food security, an increase in fruit and vegetable intake, an increase in their sort of self-reported perceived health, satisfaction in the program, et cetera. So that's just one example of success from the produce prescription space. I don't know if others want to. No?
You guys are good? Yeah, I mean, that was a lot of really incredible information in a very short amount of time. So I really appreciate that. It was going to open it up to see if we had any questions here in the audience. Joey is on his way.
Under this program, are there any requirements for organic vegetables? Because I'm convinced that pesticides and herbicides also affect our health.
So they don't talk specifically about organic produce when you're looking at this particular model. I think across the country, you'll find examples of folks who have done programs that specify that the produce is organic, and others who have not. There's been sort of a mixed bag, and I don't know that there's any like national consensus in terms of that.
I guess I'll just add, as a policymaker, sometimes we don't like to get too prescriptive when it comes to these types of programs because number one, it doesn't allow the participant the autonomy that they deserve to have when they're making choices in the grocery store. And two, sometimes the cost of the organic, and I totally agree with you on pesticides. We all know that's a huge issue. But the cost of the organic can be so prohibitive that the quantity of food that they can get is much less. And when we're talking about people who just need food to eat to make it through the day, we certainly don't want to be providing them with the benefit that is so prescriptive that it doesn't allow them enough food to feed them, feed their children and stuff. So I think there's some pluses and minuses to being prescriptive about decisions that you make when it comes to policy, especially when we're talking about SNAP.
And I would just add, that's also where you can get more prescriptive on the educational piece of things. So you can provide the participants with that information so they can make their own choices about whether or not they want to spend their money in that way, and to make sure they're equipped with the information to make the decisions that's best for their health.
Thank you. Anybody else? Question right over here.
Thank you. I've been to, for years, I've been going to farmers markets in the summer and spring, fall, summer. And this summer I got to thinking, what happens when it's the end of the day, the farmers still have quite a bit of produce left. Is there any sort of partnership already going on, you know, in any way with a food pantry or anything else to help them move that produce to somewhere where it will be used? So that's one question. But I also have a question about the farm bill. Is there any connection, the current farm bill, any farm bill, the one that we've had, the one that we're trying to get through now, anything having to do with food as medicine?
As to the farm bill, nothing specific, no, in the current farm bill. As far as the farmers market question, I'm not sure about farmers market specifically, but together as a food pantry works with the food bank for the Heartland to do what we call enabled pickups. So we have an individual that goes around to a variety of grocery stores and some like restaurants in the area to pick up things that are like day-old bread or things that will expire in the next couple of days, and then we can offer it to our participants. And that's one of the ways that we most frequently can offer fresh produce, fresh dairy, things like that. So that is the way that we facilitate those kinds of fruits and vegetables at food pantries a lot. So, but I'm not sure about farmers markets. But I can look into that for you, find out.
Or so, maybe time for one more question.
If there's a
I just have a question. I'm excited about the opportunity to expand Medicaid and have those dollars be used for food as medicine. But as a guardian to my brother who has intellectual and developmental disabilities, who is on Medicaid, the system is not always easy for folks to navigate. And I've done that. I've been on the Medicaid site. You have to apply for the different, waivers of the different services that you need. That can be very challenging and frustrating. It's almost like sometimes it feels like it's intentionally so that you are either denied what you're eligible for, or you just get frustrated enough to where you don't continue that process. And we've been through that personally with my brother. So I guess my question would be, how can we ensure that folks who are eligible to use those dollars in that way, how can we make it as easy as possible for them to be able to do that?
Well, I was so a lot of times where we've been able to intervene in those spaces where people fall through the cracks a little bit is through benefits navigators and case managers. So when people come to our pantry, they first have to sit down and talk to a case manager who walks through their situation. If they need diapers from the diaper bank, we have a stock there. We provide for diapers through there. Ask them some basic questions about things just to kind of track our numbers, but also to check and see if they might be available for SNAP benefits or WIC or TANF or any kind of those Medicaid. And then they can help them navigate those resources. That's not something that's always available to everyone. And I think ideally that those kinds of navigators, that kind of assistance would be helpful, because I think for anybody, I mean, it's in kind of a quagmire. I have to agree. So.
And I'll just say, if your state were to modify their 1115 waiver, that's going to be up to your state's authority of who's then responsible for determining those changes to your program. And I can give you the example of California. They have convened experts across the state, and they're figuring out right now how to even just make the codes that trigger that someone can get those benefits. And the truth of the matter is, this isn't easy because we're talking about two broken systems working together, right? Our food system, newsflash, in case you don't know, it doesn't work well. And our healthcare system isn't working well, right? And so we're looking at building essentially some connections between two networks that have never worked before. So there's going to be a lot of bumps in the road while we figure it out. But there are a lot of smart people who are trying to figure out how to ease that burden and make those benefits more available. But I think it would require a lot of advocacy on the part of those, the state kind of embracing a process that allows people to provide examples of how they need this type of program to work.
And now I'm going to turn us over to our next panel. A recent exploration by Flatwater Free Press has showcased how Nebraska communities are growing more diverse. In 16 counties, population growth is coming entirely from Nebraskans of color, and in many rural communities, first, second, and even third generation immigrants are keeping towns thriving. With an increase in immigration comes a shift in the demographics of our K-12 schools, often including a rise in the number of students qualifying for English learner services. Our panelists for this panel will explore the impacts of this diversification in urban and rural schools across the state and discuss what can be done to promote family engagement, early learning, and discuss how policy solutions can help all of our students achieve. Please welcome our moderator, former Senator, current Millard Public Schools School Board member, Amanda McGill-Johnson, and our panelists, Ann Hubble with the Department of Education, Itzeni Nayeli Lopez, who goes by Nayeli, with the learning community of Douglas and Sarpy counties, and Karma Ridpath, who teaches in the Dorchester Public Schools. So thank you so much for being here.
Thank you for having us. And, it's a real honor to get to moderate this panel. I know in Millard Public Schools, every year now, we're seeing a couple percentage points increase of English language learners. And so I'm excited to learn from this wonderful group of women. We'll start off by kind of setting the field by asking you to describe the current landscape of English language instruction in Nebraska's K-12 schools, how it has changed over the last 10 years, and what seems to be driving that change. And we'll start with you.
Okay, so can you hear me? I thought that we would go ahead and just kind of share on our NDE website, we have a Nebraska demographics. So if you go in and you look for the English learner and you go to the Nebraska information, below is a Nebraska demographic. And we have the amount of students per district or per county. And then we have the languages, and we start with, oh gosh, I think they started keeping that information in 2014 or something like that. And we get what's called EdFax reports. And so we're getting the information from school districts. And the current that I have is the 23-24 school year for our EdFax counts. And that number was 29,629 English learners in the state of Nebraska. Just to give you a little context, the year prior, 22-23, was 25,884 English learners in the state of Nebraska. I can let you know that the way that we know if a student is an English learner is a process that the schools do when they register. The very first thing that we do is ask a home language survey, and that's asked for every single student in the state. So if you're a new student to a school, you come in, welcome. There are 3 questions that they just ask. What's the first language the student learned to speak? What's the primary language that the student speaks? And what's a language that's used primarily in the home, even though the student may not speak it? So if there's a language other than English to any of those 3 questions, then there's a screener given. And the screener then identifies if that student is going to need support in learning English. We so far have given 4,000 screeners, July or whenever they start for pre until now. Now, not all of those students qualify for English learner services. A percentage meets proficiency and they don't qualify to be an English learner. But that's just a little indication of the growth that we're seeing across the state. The other indication is the phone calls that I receive. We're getting an English learner. We've never had an English learner in our school before. What do we need to do? And so we provide the support to get them started. And that's just a little bit. I can tell you that our numbers, we also have grants. The Title I grant is to support all students with learning, if many are reading and math. And we have Title II grants that support the professional development for teachers. And Title III is to support English learners and immigrant students. And so far, if you are interested, on our website under the federal programs, you can see the 24-25 allocations, which districts receive funding for this population. So there's some information just to give you a little bit about the landscape. But I think we're going to let Karma talk about her district.
Good morning. I teach at Dorchester, and we are a small Class D school district, all inclusive in our community, pre-K through 12. And we have approximately, it varies a bit from year to year, about 235 to 240 or 245 students. And looking back over the past few years, I've been very fortunate that I've been at Dorchester for a number of years. And I remember when we first did get our first family, that English was not the primary language. And thinking back, that's been definitely over a decade ago. So we have grown, we have morphed as time has gone by. But if we look at our percentages, looking back, at the 1920 school year and the 2021 school year, we've wavered between 9% and 12% of our student body that have been considered EL after we've gone through the process that Anne explained with the home language survey and the assessment. Moving into this school year, and this is just an estimate because we already know that we will have a fluctuation occur next week. We have gone from that 9 or 12% up to 17% of our students are now going to be accessing EL services in our district. So we have seen the 9 to 12, but now that is clearly starting to go up. Nayeli?
Yeah, so my name is Nayeli. I work with the learning community of Douglas and Sarpy County, and we have the opportunity to collaborate with 11 school districts. And we have 2 centers that support Omaha in North and South Omaha area for parents. And one of the interesting things that we've seen as districts are reaching out for support from the learning community is that area about our EL student populations and how do we engage the families, how can we support the students, and just maneuvering how do we get them registered as easy as that. I believe our growing districts, even in DC West and Bennington, are starting to face those challenges. And when you were asking about what are some of the trends that we're seeing, we have increased the number of refugee people that are coming into our state, as well as our migrant communities. And we also have seen a lot of diversity even along our Spanish-speaking communities or our Latin American communities that are settling in Omaha. There's a lot of indigenous languages that are being spoken at home that sometimes people may mistake to believe that they are Spanish-speaking communities, but that's not the case. They have another native language from their native country, and sometimes it may be mistaken by Spanish speaking and struggle as well with navigating the school system.
Thank you. What challenges does this increase in EL population pose for districts? So is the EL workforce sufficient to meet this and support this growing population? And does an increase in EL students pose additional challenges for staff development in your general education environments? Who'd like to go first with this one?
When we're thinking about supporting our EL students, many times our conversations with our districts talk about the language acquisition and how to best support the students so that they're able to learn the language efficiently and fast and being able to, start taking regular classes per se. But that's one of the challenges when we're thinking about feeling like you belong in the school district, feeling welcome by the school districts, and just feeling that you're able to advocate for your children's education beyond the needs of just being able to speak the language. So I think that the superficial challenges that many times when we start is the endorsements to be able to support EL students in the classroom and having enough staff that may be bilingual, the shortage of staff that we have for bilingual students. But that's just the beginning when we start thinking about the iceberg and ensuring that the students are reaching all of the milestones and that we're able to support them in those areas. A lot of the work that we do at the learning community is helping parents that live in the area navigate school systems and then teaching them how they can be the best advocates that they want to be for their children's education, because then we start adding those layers about if they're falling behind academically, if they have autism, for example, or another learning disability, and just feeling comfortable to ask the teachers, how can I best support my student at home?
Yeah, I'll just ditto all those challenges. And I'll just add that the serving models. So depending on your resources in your district, what kind of a language instruction education program can you offer? And Nebraska has a Rule 15 that provides guidance to all districts on welcoming and identifying their students, on providing a language instruction education program, on staffing and professional development, on assessments and our standards, and how a student can exit the program. So that we have the entrance and exit, and all of those kinds of things are in our rule. So having appropriate programming, sometimes if you don't have the resources and you've never had a student, oh, how do we serve a student who's a brand new, welcome to the United States, and we don't have any English yet. And now we're going to go into a high school class and we're going to have to access the content, and we need to acquire this language as we're going. So what are the ways that we can help train our teachers to be able to meet the needs of their students through lots of different strategies and thinking through creatively, how can we structure a program that really does meet their needs within the resources that we have? And so those are things, and I'll get to some of those, how do we provide the resources? But the challenges really are the serving models, teacher training, and we don't require that all teachers who work with English learners have an endorsement, because we recognize the limitations that some districts have. So what we do ask is that we provide some kind of professional development so that they have some knowledge of language acquisition, they have some knowledge of strategies. And so we've been working a lot on the resources end to provide these resources for districts. And then I always think about confidence, because a teacher may be very afraid. And I recognize, when I had my first English learner, and I thought, but I don't speak another language and I don't understand. They don't understand how am I going to, and then you build your confidence because you start to see these strategies really work. And I always come back to first language acquisition. Think of young children, as they're acquiring their first language of English or whatever that is, how much they take in and understand before they ever even say any words. And so you think about that process, it's very much the same for anyone learning another language. It's a little more difficult as we get older. I can just tell you, it's not as easy, but it is fun to watch and to see, so we can build the confidence for our teachers.
And I support what Anne talked about. We have been in contact with Anne throughout the past few years, tapping into the resources that NDE has made available to us. And at this time, I am not an EL certified teacher. I'm certified in other areas. However, we have utilized a resource that Anne has. I went through the NDE Canvas course, which was a wonderful overview of the information we need to have. And I'll support what you said with, we have teachers in our district that are so willing to serve students. And our first step is to make those connections with students. If we can communicate with the students, and we communicate with them through a variety of ways. We have some amazing bilingual paras in our building, and we also use our technology. If we can make those connections with students and make those connections with families, everything else falls in place. I like to look at our staff as we are ready and we are willing. I think one of the areas where we do have a big challenge, and this isn't just in our district, it's across the state, is to support new educators so they do have the tools. It doesn't matter what area they're being certified in, but there's an awareness of strategies and tools of how to work with students where English is not the primary language. Big picture, we just need to look at our communication pieces and our collaboration pieces. And we have some amazing things in place in our district. And looking ahead to the big picture, we need to continue to look toward the future so we can continue to grow and continue to provide what students need. And so that's what I have to add.
Well, let's stick with you if you don't
Okay.
mind. Let's talk about parent and family engagement. What are some creative ways that you've supported parents and guardians so they can have a sense of belonging within your district? And how does that impact student achievement?
Anne spoke a little bit about the different pots of funding in Title 1, 2, and so on and so forth. And so looking back about a decade ago, we went from a Title I targeted assisted program to a Title I school-wide program. And at that time, we had some English learning students, but we primarily moved toward a school-wide program because that was a time in history where we did have the 40% of our students that qualified for free and reduced lunch. And that's the first step to becoming a Title I school-wide program. And so we worked at using our resources to become a Title I school-wide program. Looking back, that helped us tremendously with where we are now, because we can use some of those resources and those fundings to also work with our English language learners. Now, talking about what we provide for families, this goes back to the Title I. Through Title I, you reach out to families, you have annual meetings, you figure out ways that you can connect with families. And that was our stepping stone to putting together many of the initiatives that we currently have in place. Reaching out to our families. When we have new families come into our building, we immediately try to make a connection with them with our bilingual paras. We give tours, we welcome them in the building, we have school t-shirts that make the families and the students feel welcome. Other things that we have done, we have churches in the community that provide backpacks and supplies for families, not just English learning families, but all families who have that need. And that's what we've started to look at, is not looking at English learning students or Title I students or special ed students. We look at families and students and we figure out where there's a need. We try to not look at programs, but at needs, and make those connections. We also offer summer camp, reading and math summer camp, a week in July and a week in August, or excuse me, a week in June and a week in July before school starts in August. And that is a great way to have students in our building meet with families. If we have new families that are coming into the district, and that happens in the summertime, we try to make that invitation available to them as well, so that we're making that connection with families and students before school even starts. The past few years, we've been able to offer free breakfast and lunch during the summer to students up through age 18. And something else that we have done that helps welcome the families and make them feel a part of the community. With that, when teachers are cleaning up their classrooms, if they run across some learning activities that they don't plan to keep, we usually keep a table of those items out during the summertime. So when families come in for breakfast or lunch, they can help themselves to those materials. That's a good way to get print and books into homes. We have a back to school night where we offer translating services to help families fill out paperwork. They're able to come in the building, meet teachers, meet other staff members. We offer hygiene products like shampoo, toothpaste, toothbrushes at that back to school night. So if there's a need for that, any families, they have accessibility to that. In the spring, we have a big spring carnival. All families are welcome to come. It's a great way to end the school year. We make that connection with families again. So over the years, we have put several things in place where we are connecting with our families, all families in the district.
Great, thank you.
It's wonderful to hear from a district perspective because I get to kind of hear from a whole state perspective. And I'll let you know, one of the biggest things is collaboration. And you know, you can't do anything by yourself, but with others, you can really collaborate. And at the NDE, we do have a family engagement department. And one of the people that used to be at the NDE is now with another organization, Nebraska Families and Children. And so I continue to collaborate with him as far as resources and what's going on. I can let you know that it's fun to hear all the different district things, but we have offered from the state through a grant, and it's called the Project Assets. Again, if you go to our NDE website, it's on the side. It's for both educators and for parents and families. For the educators, it offers them an opportunity to earn a micro-credential, which is not as strong as an endorsement, but it's pretty darn close. They go through an 18-month program and they really learn about good strategies for supporting English learners. And that is something that is paid for through the grant. And so they get a stipend for participating and they can earn college credit, graduate credit. The other piece is for our families. And we have partnered with the Education Achievement Services, and the founder of that is Consuelo Kickbush. She leads the Family Leadership Institute. If you've not had an opportunity to interact with Consuelo, you need to, because she's amazing. And she was an English learner herself. And so she's an immigrant story, and she talks about her background. She went into the military. She's a retired general. She's got a lot of accolades, and she runs our Family Leadership Institute. We've had 3 cohorts. We're going to start our 4th one next week, all virtual with an in-person graduation. I've gone to the in-person graduation ceremonies in Omaha. We partner with Heartland Workers Association, and we've had over 180 families come across the stage, receive their certificate because they participate in 10 modules. It's empowering, it's advocacy, it's being proud of who you are and your heritage and giving that to your children and helping your children. And it's just it's a phenomenal opportunity. It's open to any multilingual families in our state. So again, it's on our website. I push it through all the districts and let them know about it. But it's not, it's partnerships. We also have a number of other districts doing their little family institute things. And I know that Bellevue is offering a family opportunity this Monday. They invited me. I wasn't able to come. I'm not able to attend, but they've been doing family literacy for 4 years, and it's grown and grown and grown. So the families come into the school district, learn English, and participate in family activities with their children. And so it's a real positive. Columbus, I think this last year, I was just talking to an ESU person, and his wife is teaching the English classes in Columbus in the school where the children are. The parents go to the same school where their children are. In the morning, they have English class. Then they get to go and partner with their children. They get to be in their children's classroom for maybe an hour to again feel a part of the community, to understand what's going on in the schools. These are just a few snippets of things that I'm hearing about. I know that there are other things happening. It is a part of our Title I grant to include families in your family engagement. It's also a part of the Title III. There needs to be some parent, family, and community engagement. And so many districts are very creative about how they offer that. So I think I've mentioned most.
Thank you, Ann. The learning community has 2 elementary learning centers. If you're not familiarized with our funding, we're a political educational subdivision that receives funding from a tax levy. And the purpose of the learning community is to close the opportunity gap in collaboration and partnership with 11 school districts. We have 2 centers that are based in South and North Omaha. And when we did the needs assessment, asking families, what do you need to help your children be successful at school? One of the key areas in South Omaha was to help to learn English to be able to navigate the educational system. So our program, we offer ESL, workforce development, and GED courses for adult education. We do follow the model from the NCFL that talks about adult education and children's education in a two-generational approach. We have had this program going in South Omaha for the last 12 years, and we have an external evaluator that comes and evaluates each and every one of our programs. We were seeing trends, that positive correlation of parents when they are able to navigate school system. They learn about early intervention, reading at home, how to best support your children, and have those wraparound services. We were seeing a positive trend of our students whose parents attended our programs. Their children were doing much better in reading and math skills compared to the state level and compared to their peers from ELL students. The pandemic came and messed up a little bit of the things, just like everything else. But when we think about intervention programs and supporting parents that are living in poverty, parents that have other barriers to be able to navigate the school system, this is a great way to add that preventive mode. Our parents, we catch them early when they have either when they're pregnant or have a child under 4 years old, and truly investing in parents' education to help them navigate not only the school system, but also their community resources has a positive correlation for their students to do much better academically and being able to reach graduation rates that will impact our workforce development area in the city.
All right, let's talk about assessments. Do you feel that the standard assessments as they're currently formatted reflect English language or English learners' true mastery of the material? And what could be changed to make them more equitable?
Well, I can speak for our ELPA assessments, the English Language Proficiency Assessments. We have 10 ELP standards, and the first 7 of those standards all correlate to content. I do a quick reference title because otherwise they're kind of wordy. They're not too bad, but I can tell you all 7 of them. But they're things like constructing meaning, comprehending what you see, what you hear, and what you read, exchanging in information, reading, writing, speaking, and listening, speaking and writing, being able to give presentations, being able to participate in discussions, constructing a claim, being able to provide reasons and evidence to support that claim, adjusting your language to your task and audience, doing research. These are all of our standards. The last 3 are language focused. Number 8 is understanding the meanings of words and phrases, vocabulary. 9 is clear and coherent speech and text. Are you able to produce good sentence structures? And are you able to have a good organization in your beginning, middle, and end of your writing or your speaking? And the last one is about grammar, the ability to use accurate grammar, English language, the standard English language. So we have a combination in our standards and our ELP assessments. We have a screener. It's just used to identify if a student qualifies for the program or not. It does give the district a little information. Are they a beginning or merging, or are they progressing? Do they have a little more language, or are they proficient and they don't qualify? If they meet proficiency on the screener, they don't qualify for the English learner. However, we always say there may be things that they're not aware of. If they've lived in another country, if they come from another language, there are many things. Sometimes I think, what is that again? I haven't heard that expressed, right? Our language is always growing. And so you have to know a little bit of context to understand the whole thing. But our summative assessments are really pretty rigorous. They do measure content and they do measure language. We feel very confident when a student meets proficiency on the ELPA assessments, they're doing very well with their language development. And we want to continue to see that growth in the content. So then we look at our NSCAS. NSCAS is the Nebraska Content Assessments in Math, ELA, Science. Basically, those are the 3 main ones. And we do see that sometimes our English learners, our multilingual learners, are not performing as well as their peers. Again, this comes back to good teacher preparation and training to help our teachers. And there are 4 practical concepts that we try to mention when we do trainings. High expectations. High expectations are higher order thinking skills. A student that's just learning English may not have enough language to use the vocabulary or to produce complete sentence structures, but you betcha they can evaluate. They can look at pictures and they can know which one would be the better picture, or they can look at chronological order. They can do pictures and they can so higher order thinking can happen no matter the level of language. We try to make sure that that's very clear. We also promote a lot of collaboration. You can't do it by yourself. You got to work together. There's got to be collaboration. Comprehensible input, that's understanding the messages you receive. Visuals, gestures. If you use those, students may not know all the language, but they will understand your message and the language will come. And the last one is language output opportunities. The more students get the opportunity to practice language, the better. So all of those things we try to encourage in every classroom, not just the English language classroom, but in every classroom, so that our students get the opportunity to really develop that language. We always say, academic language is no student's first language. So this won't hurt any student because they all need practice with academic language, but it's essential for our English learners. So that's a little bit about our assessments. Of course, we always have word to grow, but we're always looking at the data and trying to help. The other thing is we look at growth data. It's not reasonable to expect an English learner who just arrived to be proficient in the spring. They're going to go through growth. It's also not okay for them to stay at a beginning level. So we need to be moving, and we have some benchmarks for our districts to be looking at to see, are you seeing growth in their language development? The more we can help them with that, the better.
And I'll tag along with what you said, Anne. I had my first experience giving the ELPA when school started this year, and I did give the screener. It was a good experience, and it did give us the information we needed to qualify students that would be at need for English learner services. But what we always also do along the same line is we don't just look at our ELPA scores as students progress through the grades. We're also looking at other scores like our NSCAS scores or our district assessment scores. And we have data meetings as well as coordination days in our district where we talk about those scores, but we also talk about how students are progressing because it's very individual. Each student has their own skills and they will progress at their own rate. And that is where we make adjustments to what we are providing to students so they will continue to grow. So the ELPA isn't the end all, but it's a piece of the assessment package that we look at in our district. And that will continue to change.
I'm going to go ahead and combine our last pre-planned questions so that hopefully we have a few minutes for questions from the group. What do you see as the future? So either how your districts or organizations are planning ahead or how the state can be more helpful and policy can be helpful.
Looking ahead to the future, we are having conversations about how we can be fiscally responsible. How can we provide what we need to provide with the funding that we are receiving and meeting the needs of all of our learners? Moving into this school year, we're looking at the needs of students according to what skill areas do they have needs rather than the program that they qualify for. And we are just a month into this new model, and I feel like we are making gains. We don't have overlaps. We're providing what students need, and we're using the dollars appropriately. But it takes a vision to move toward that sort of a model. And I know we have a lot of adjustments to make. As a matter of fact, we are having one of our first meetings tomorrow where we will look at what we have in place with classroom teachers, We'll have a lot of conversation, and through collaboration, I know we'll change some of the things that we do have in place, but it's a great first step. And as a small school district, I think we're moving ahead in the right way for the future.
And at the state level, we're always looking at, I do a learning map every year, the collaboration is at the center. How do we collaborate to strengthen our programs and services for our multilingual learners and really all students? But we really do have some goals as far as resources. So we know that there are districts who don't have teachers who are EL endorsed, and they may not have a lot of experience. How do we support them? So we've created like a starter kit or a checklist. These are some of the first things that you're going to want to do to get yourself so that you understand. We want them to understand the why and the how so that they're able to work with their students. It's not just about try this strategy. It really is about understanding language acquisition and culture and understanding how you best meet the needs, including the families, collaborating with each other, and then trying some of these strategies that really do benefit. Some other things that we want to do is make sure that we're collaborating with our ESUs across the state, because we have a number of ESUs that can reach different smaller districts. And so we have Title III consortia directors in a number of our ESUs, but we have some ESUs that don't have a Title III director. So for example, ESU 7 has a Title III director. He's reached out, and we had a meeting last week, a great meeting with a lot of his school districts. ESU 1, ESU 2, ESU 8, we're all there. And so they are learning some of these good practices for English learners. So we're growing our capacity at working with these students so that we can promote their language development as well as content. And I'm thinking other trainings that we see as recognizable. I'll just say Omaha is having a wonderful, wonderful fall conference, November 2nd. They're bringing in, I'm going to say, some big names. Academic language is Jeff Swears. He's got all the academic language. He's their keynote. And I just looked through, so I'm just promoting this because we send out newsletters, we try to get information across the state, but when districts are doing good things, let's share them and let's invite others and collaborate. So
when I think about the future, I'm an OPS student graduate, and there's a lot of research about dual language programs, and OPS has done beautiful job to start integrating dual language since kindergarten all the way through high school, and the evidence base that it brings when you're able to integrate multi-languages in a district, and it's easier for the students to learn the language and just continuing to build upon those areas. So that will be one of my dreams. Yeah.
So another collaborative group that we meet with is a higher ed group. And so I had UNO, UNK, UNL, we had Wayne State, and we had Concordia. That was just a Zoom meeting. We try to do them twice a year. And one of the things that we talked about is a collaboration. How do we help increase or make it not so difficult to get an ESL endorsement or a bilingual education or dual language endorsement, so we can have more dual language teachers and offer more dual language programs. So again, it's talking and collaborating with each other. So we're on the same page.
Thank you. So that was that for the dual language. And then I continue to echo the collaboration piece, especially for rural communities, and not even all the way rural. Like when I work with the districts, DC West and the access of resources that they may have available compared to OPS or metropolitan area is not that far off when we're thinking about, the resources, but just that collaboration piece. Research has shown that the more you collaborate with agencies around the area to be able to provide those resources to the families that they may need when we're thinking about those social determinants of health and just the wraparound services, the students are able to be more successful when they have that stability, and the parents have the tools and the skills to be able to flourish in their communities. So those are important pieces. I echo with Anne about the collaboration piece and just we're stronger together, and don't feel afraid to reach out. Yes.
We may have time for one question, one maybe two.
Hi, you've talked a lot about need-based strategies. How do you prevent families from feeling that they're deficient or being patronized? And are there any strength-based strategies that you use? And this relates to cultural competency specifically in the title.
So I can tell you that the project assets is very much strength-based. It's building up who they are and what they bring and feeling very empowered. And so that is something that I've seen, and it's just a wonderful experience because it's just good for all families. You know, recognize what you might not have, but yet you recognize what you do have. And again, we're working on always welcoming. So inclusion, being a part of the school, being welcomed, having those programs in so that they feel that they're a part of. And some districts, I know that they do, you know, they invite them to be a panel and a speak to the staff and just share what their stories are. But those are just a couple of things, for examples.
When I think about, I once heard a speaker said that no one knows nothing, everyone knows something, and thinking about, you know, what we bring to the table and how we're able to incorporate those parts. I know a lot of districts are working right now after the pandemic. We were kind of like, don't come into the buildings. We want to protect the children. And now kind of the parents are used to the drive-through dropping off the kids, right? And how do we welcome back again parents to feel welcome to come to the schools, to ask questions, and just being able to share their resources. There's a lot of initiatives that are happening in many districts to be creating that welcoming stage. But I think that even as an immigrant member, just extending a hand and smiling can go a long ways. You know, going back to our basics and doing some of those trainings for all of our staff, because the schools have a lot on their plates. Like even when Karma was talking about all of the resources that they provide for families as they're coming in, the schools naturally are a safe haven for families. They, you know, because they feel like this is a school, my kid is safe, so I'm gonna go and reach out for help or support. And sometimes that can be very heavy on the staff, and it can feel, you know, a lot of work. Like not only do I have to teach the students, but I also have to provide a food pantry, you know, for families. So I think with that area, with when we're thinking about the strength-based approach, is not jumping into our fixing train, but being more welcoming and asking questions. What current assets are the families have in place? What can they do to support their kids? And then just meeting that, helping them problem solve, so that we're not just saying like, here, you can have all of this without even understanding the complexity of their situation.
One last question.
Okay, so that varies all the time. One of the reports that I have was about 118 languages in the state of Nebraska. And like, I think we talked a little bit about, there are some different dialects. And so, you know, there are the most common language is Spanish. And then on our demographics, the next top are Arabic, and some places Karen, and some places Somali, and then some Mayan, and then a whole big population of a lot of singletons, or very small, you know, but a lot of variety. And different regions of the state have different pockets. Like Lincoln doesn't really have the Somali population, but Omaha does. And Mayan, more up in South Sioux, and Shadron, which was kind of an interesting. So, yeah.
All right. Thank you so much to our panelists for a fascinating
program to work.
conversation. Thank you all for sticking out with us through the course of this morning. We've had a variety of different types of conversations, and we're excited now to launch into our keynote presentation. When we began planning today's program, we had no idea how timely the wisdom of Derek Black would be for Nebraska. A national expert on school funding and the school privatization movement, he's been keeping an eye on Nebraska education policy for years, since he first published in the Nebraska Law Review in 2003, and I looked that up. on rural schools. He's been closely following our recent policy debates over school funding, property taxes, private school vouchers, et cetera, including the case heard just last week in the Supreme Court. Derek Black is professor of law at the University of South Carolina School of Law and the Ernest F. Hollings Chair in Constitutional Law. He's one of the nation's foremost experts in education law and policy. He offers expert witness testimony in school funding, voucher, and federal policy litigation, and his research is routinely cited in the federal courts, including the U.S. Supreme Court. He's also a regular commentator and an op-ed contributor in outlets like USA Today, the New York Times, the Wall Street Journal, and the Washington Post. He began his career teaching at Howard University School of Law, where he founded and directed the Education Rights Center. Prior to his teaching, he litigated education cases at the Lawyers Committee for Civil Rights under law. He's also an extensive and prolific author with a forthcoming book, we understand, called Dangerous Learning: The South's Long War on Black Literacy, exploring the connection between the criminalization of Black literacy and freedom of thought in the 19th century through to today's attacks on racial equity, racial history, and public education. Please join me in welcoming back to Nebraska, Professor Derek Black.
Well, thank you for that, and thanks for having me. Real pleasure to be here with you and the OpenSky Institute, and was just talking with Rebecca about how lucky the state is to have such an organization. We don't actually have one in South Carolina, and I can tell you it certainly makes a big difference in a bad way that we don't have one. So congratulations to you. And it is full circle. You know, I told Rebecca about the Nebraska connection and kind of had forgotten about it. So I don't know if anyone in the room knows Greg Malhoit. Greg Malhoit graduated from Nebraska Law School probably in the 80s and went on to become one of the sort of most prominent school funding litigators in the country. He was sort of, I don't know, they called them the Godfathers. But anyway, there was a couple of them and he was amongst them. And so when I was graduating from law school, he was running the Rural School Trust at the time and had asked me, I guess maybe a sign of how thin his budget was, but it asked me, a recent law student, if I would write something for him and co-author it with him in the Nebraska Law Review, which was doing a symposium on school funding. And really, I think writing that article with Greg really helped set the trajectory of my career in terms of school funding. So certainly a special opportunity for me to be part of that symposium issue a long time ago, and glad to be here with you today. And hopefully I've learned a thing or two since then. We'll see. So my book Schoolhouse Burning came out in 2020, and I've gone around, talked to lots of school boards and superintendent associations about schoolhouse burning, public education, the assault on American democracy. A lot has changed, unfortunately, since then. And it seemed like maybe that was a bit dramatic for Nebraska. So I thought I'd retitle the book, at least for today, to be Schoolhouse Burning, Nebraska Style, with a touch of common decency. So I think that you have some of these same issues cropping up, but I don't think they've yet come quite as invasive and problematic as others. But they're definitely things I think you have to keep your eyes upon when you look at what has happened elsewhere. So let me start, as I do in the book, with, and if you'll indulge me for 5 to 8 minutes, to sort of situate historically where education fits in the democratic project, and where Nebraska then more specifically fits in that history itself. And then I'll move into more wonkier issues towards the end. But what we have here is a map of Kentucky and a map of Nebraska. And I didn't choose Kentucky for any specific reason, but when you look at that map, you notice something quite different, I would suppose, which is that the lines between the counties are quite jagged in Kentucky, but they are straight as an arrow in Nebraska. Has anyone in here ever driven from Pennsylvania to Ohio or Kentucky into Ohio? Yeah. Well, and you know, I like being a slightly older crowd because when I ask that question, it's normally to people who've never seen a physical map in their lives. And so you ask them these questions and they're like, I'm just following, you know, what Google says. But in those old days, or I should say in our younger days, you used to flip open a map and you'd look at them and you could see the county lines, and things get radically different when you move from Pennsylvania into Ohio or from Kentucky into Ohio. Because Kentucky, I should say Pennsylvania has these same jagged lines, but Ohio does not. And you have straight lines in counties from Ohio to the West Coast and north to south. Why is that? The answer to that question is the Northwest Ordinances of 1785 and 1787. And I'm guessing most folks in here may not be that familiar with it, so I'll just tell you, the Northwest Ordinances are one of the 4 foundational documents in our democracy. If there's any lawyers in here who also happen to have old books in their offices, like the United States Code, if you were to open it up and look at the beginning of it, what you would see is that in every printed copy in the United States of America of the U.S. Code, there are 4 documents: the Declaration of Independence, the Articles of Confederation, the United States Constitution, and the Northwest Ordinances. The Northwest Ordinances are the land deal that makes the United States Constitution possible. For whatever reason, Virginia, Pennsylvania, and Connecticut, of all places, thought, all 3 of those states thought or claimed that they owned all the land west of Pennsylvania. Again, I kind of get it for Pennsylvania. I don't know why. I mean, I kind of get it for Virginia because West Virginia touched that corner, but Connecticut, those were some greedy folks, I guess. But in any event, they all claimed that they owned the Northwest Territories. You cannot have a United States of America under a constitutional democracy if 3 states claim to own all the remaining land in the country. You can't form new states. You cannot grow your state, although we don't have a grow your state beyond its border principle anymore, but you can't do that with that competition. So the Northwest Ordinances passed unanimously in Congress with many of the same people who ratified the United States Constitution 6 weeks later, by which all the states gave up their claims to Northwest Ordinances, set the rules by which states would, territories would become states, and carved that land up into squares. That all the county lines would be carved up into squares, and all those counties would contain towns that would have exactly 32 lots. And the 16th lot in every single remaining town in the United States of America would be reserved for public schools. And 9 of the 31 other outlying lots would be reserved to generate resources for those schools. So before we even have a United States Constitution, we have public education, physically and structurally, placed at the center of the growth of American democracy and the creation of statehood in the territories. 31 other states would enter the Union pursuant to those rules, and that explains why your lines here are straight in Nebraska as well. You weren't part of the Northwest Territories at that point in time, but soon would be. And in that document, it said, schools and the means of education shall forever be encouraged. These ideas didn't come out of nowhere. They actually came from 2 of our founding fathers, Thomas Jefferson and John Adams. John Adams in 1776, and actually even in the lead up to 1776, had said that, that we need public schools, right, to have a Republican form of government. That it is public schools where we will realize the common good, we will have a common experience that allows democracy to move forward. In fact, Adams argued that it was more important to the upper ranks of society that we have public schools than it was to the lower ranks. Now that might seem like a strange idea, but he and a lot of the other paranoid elites of the time realized that if they were going to hand over political power to a bunch of farmers, those farmers might just decide through the ballot box to take their stuff, right? And therefore, it would be the common schools with a common experience and common values around which we could build democracy that were central. Jefferson came at this a little bit differently. Jefferson believed that the only proper exercise of government authority was with the consent of the people. And the only way the people could consent was through knowing consent. And knowing consent required education. These two men embedded these ideas very early, prior to the Northwest Ordinances. The Massachusetts Constitution of 1780, which ends up being a blueprint in many respects for the United States Constitution, also includes the world's very first education clause. And it provides, it shall be the duty of the legislatures and magistrates in all the future periods of this Commonwealth to cherish the public schools and grammar schools in the towns. That it mandated via constitutional provision that the schools be provided for. Jefferson spent about a decade working on a bill for the more general diffusion of information, and in that, which had a lot of these same concepts of dividing up districts that you find in the Northwest Ordinances, in which he said the most effective means of preventing tyranny would be to illuminate the minds of the people at large and to do it at the common expense of all. Now, of course, America was far from perfect then and certainly isn't perfect now, and our democracy nearly fails, right? Public education could not cure all the ills of society. Millions of individuals were enslaved in the South, and public education, to be quite honest, didn't exist in any meaningful way for white or black children in the South prior to the Civil War. But at the end of the Civil War, black people in particular believed that education was central to their ability to be citizens, that education would be part of the rebirth of democracy in America. So black people across the South, and also actually in some northern states, gathered in what were called the Colored People's Conventions. The Colored People's Convention of the state of South Carolina gathered in 1865 to tell Congress what they wanted for their future and how they thought the state should move forward from slavery. And the very first unanimous resolution of that convening, by the way, it was at the AME Zion Church, the same church community where Dylan Roof killed parishioners in Charleston, South Carolina during the Obama administration. That same storied church, black people met in 1865 and said, we ask that the three great agents of civilized society, the school, the pulpit, and the press, be as secure in South Carolina as in Massachusetts or Vermont. Congress heard that call, and in the Reconstruction Act of 1867 dictated that southern states needed to do three things to re-enter the Union. They needed to ratify the 14th Amendment, they needed to extend the ballot to black men, white women and black women would need to wait another 70 years. They needed to extend the ballot to black men. And number three, they needed to rewrite their constitutions to conform to, quote, a Republican form of government. What is a Republican form of government? It was the same thing in 1867 that it was in 1776 to Jefferson, Adams, Washington, and many others. It was a public school system it was a state system that provided not only the right to vote, but public education to its citizens. As a result of that, the South went from a region in which only one state guaranteed in its constitution a right to education to a region in which every single southern state guaranteed the right to education by 1870. In fact, there's litigation right now in Mississippi alleging that Mississippi is in violation of its 1870 readmission to the United States of America because it has made changes to its constitution that do not conform to the deal it cut in 1870 to re-enter the Union. After that point, no state would ever again re-enter the Union without guaranteeing public education in its constitution. One state tried, New Mexico, and it was rejected for that and other reasons. New Mexico rewrote its constitution, had an education clause and the other fixes, and it entered the Union. No state has ever entered without one since then. And all the northern states have since, actually very quickly after that period, rewrote their constitutions to do the same. So finally, we're to Nebraska. Nebraska comes into statehood during that same period. March 1st, 1867, Nebraska enters the Union. That earlier year had passed ratified the Constitution of 1866, which, what do you know, had a provision saying that all funds arising from the sale or other disposition of lands or other property granted or entrusted to the state for educational and religious purposes shall forever be preserved, inviolate, and undiminished for the public schools. The next sentence says, the legislature shall make such provisions by taxation or otherwise to secure a thorough and efficient system of common schools. So in 1867, the state is mandated to provide for those schools. It actually has something that some of the other states in Northwest Territories had, but the southeastern states didn't always have, and certainly not New England. It has this qualitative component to it as well. We might read through it quickly, but thorough and efficient system of common schools is a technical term of art, which has led to a good deal of qualitative litigation in other states. And then the final sentence, right? But no religious sect or sects shall ever have an exclusive right to or control of any part of the school funds of that state. I went back and read some of your constitutional convention debates from these time periods. So there was another constitutional convention in 1871 and 1875. And there was this really extended discussion because apparently one of the ways at that point in time in which the schools were being funded was through various licenses and fees and fines, maybe for speeding your horse buggy too quick through town. I don't know. But in any event, all of those collected at the state level were already preserved and violate for the public schools. But there was this huge debate about, well, what about the local sheriff? What about the local community? Must they spend their money on public schools as well, or can they spend it on other things? And there's an interesting debate there. And by a vote of 38-5 at that time, they said, no, look, there's lots of important things that local communities may do around police and fire and railroads, but there's nothing more important than public schools. And so, no, we're not going to let them collect fines and fees and spend them on something else, that those particular monies will be reserved exclusively for the public schools. And also at a relatively early period in history, again, showing how committed they were to it. This one was a bit more controversial, but 34-10, the committee moves out a compulsory education provision at that point in time. Well, let's fast forward. I wanted to connect Nebraska within that sort of larger historical structure and really think about, because there's been changes to these constitutional provisions over time, think about the current constitutional structure and the significance of that structure. So that first sentence has changed a bit, but it still says, has the main pieces. The legislature shall provide for the free instruction in the common schools of this state of all persons between the ages of 5 and 21. So again, it maintains that constitutional mandate. It is not an option. It is not a legislative discretionary act. It's not a policy preference that people get to agree or disagree with. It's the constitutional mandate to the legislation that the legislature provide by this. I should also note that common schools, maybe many in this room already know it, but that's a technical term, which has been quite divisive in some other states. That common schools, right, are those schools open to all, controlled by the state. And when the state creates other education mechanisms and tries to fund them, if they are not common schools, then that means there are certain federal state funds that cannot flow to them because they are not common schools. This was a huge issue in California regarding charter schools. It was also a huge issue in Washington regarding charter schools. And all persons, again, until we put ourselves in historical context, we miss a lot of things. I mean, I had read this word all persons for the first decade of my career and thought it was not that big of a deal. But then when I went back and read the history of those state constitutional conventions during Reconstruction in the South, I realized this is a technical term. This is actually a non-discrimination mandate. That during that point in time, there were certainly discussions about whether the schools should or shouldn't be segregated, whether only poor children should be provided for or all children. All of these debates about how we might carve up and divide our schools in the 1860s, and the answer in every single one of those southern states and in Nebraska's as well, which is we will use the term all persons to signify the opposite of those other options, right? So again, another sort of important thing just to take note of. Now, your current Constitution has a lot of other sort of new provisions, and this structure is important, not for our discussion about funding today, but important for what education means and how it's supposed to be handled. Nebraska, like a number of other states, puts the State Department of Education and the State Board of Education and the State Superintendent of Education in the Constitution. What is the significance of that? Well, the significance of that is that they are not options. They do not exist by virtue of the legislature. I think we have at least one legislature. I don't know if that legislator has left yet or not, but they do not exist by the good graces of a mere 51% in the state house. And the idea in Nebraska and a number of other states was that education needed to be isolated as best as possible from the normal political process. Think about, or read these provisions, how the state superintendent comes to have his or her job. It's not by appointment by the governor. It is not by selection by the legislature. It is not even by election by the people. In South Carolina, we do it by the people, which has its own virtues because it's clear you answer to no one but the people. But here it is an appointment by the State Board of Education. And the idea being we isolate this very important education decision maker from the normal political process of making the governor happy or making the legislature happy or making people in, I don't know the geography here well enough, but sort of West Nebraska happy or East, whatever, people in Omaha versus somewhere else, right? That ultimately they owe a service to the system and to the students, not to anyone else. That's significant, right? And then what Nebraska has, and all states have them, but I might note that it seems to me that Nebraska may be a little bit more paranoid in a good way than other states, just over and over again, of what I would call 6 ways to Sunday, or maybe 7 ways to Sunday, making it clear that there are funds in this state that are reserved for one purpose and one purpose only. And it was actually I thought it was redundant. I kept reading it. What's the difference between this provision and the next one? They weren't redundant. It was covering all possible bases, at least as best as they could see into the future, to make sure, right, that funds that were raised for, created for, and purposed for education could not be used for anything else other than that. And if that was not clear enough, they rewrote that no aid clause in the Constitution as well, which provides that notwithstanding, like if you didn't read any of that, or if somehow or another we made a drafting error and somewhere else in the Constitution that you might misinterpret it, let's just say it one more time. Notwithstanding any other provision in the Constitution, appropriation of public funds shall not be made to any school or institution of learning not owned or exclusively controlled by the state or a political subdivision therein. Now, I will tell you, this is pretty well written, first of all, but there's some others that I think are also pretty well written, but maybe not as well as Nebraska's, that people twist themselves into pretzels to try to come up for some reason as to why this does not apply to their new personal favorite legislative agenda, right? Our legislature, as Rebecca mentioned earlier, we just had a Supreme Court case last week striking down our most recent iteration of voucher bills, of a voucher bill. The court had struck down another one just 3 years earlier. Before the court even decided on this most recent one, they were having hearings about another one they were going to pass before they even got the decision. No means no, I thought. But anyway, but what is all this? So that's the constitutional structure. What are the sort of more specific policy issues I want to talk with you today? Now, I come here as someone who's passed through Lincoln like in a minute 10 years ago, hasn't had the good opportunity to be back since. So I'm not here to tell you or act like I know things that you don't. So most of what I'm talking about is sort of folks here pointing me as to say, hey, we maybe think this is going on in the state. What do you think about it? I'm sure there's lots of other important things that I could or should talk about, but I want to focus in at least on two big things as I see them. And then one is vouchers in the state, and two is school funding. And breaking that down really into the stability of school funding, the effort that the state does or doesn't exert for school funding, and number three, the distribution of the funds that it raises. So to think first about that voucher question and put your moment in time in relationship to what's happening around the nation. So this is a chart that I had in my book, Schoolhouse Burning, on Florida's private school expenditures. This is before they even had vouchers, to be clear, because the Supreme Court of Florida had said no means no, constitutional vouchers are unconstitutional. And they said, oh, okay, well, we will cook up a variety of other schemes that aren't called vouchers. We can talk about them if you want to, that funnel money through a variety of other mechanisms, and maybe that will be okay. So without even having vouchers, Florida went from a state, and if we backed up just a couple of years before, I think 06, I think it was 03. In 03, Florida was spending about $30 million a year on private school tuition in K through 12. And by 2017, they were spending nearly $900 million a year. 2 years later, they crossed $1 billion and still had not passed a voucher bill yet. They were spending over $1 billion a year without a voucher bill. And then that wasn't enough. Enough is no, and enough is not enough. In the 2023 or the 23-24 appropriation, the state carved out $2.1 billion for vouchers. Now, it was easy for me to put that in perspective for folks here in Nebraska because that is larger than the entire state appropriation for public education in this entire state. I mean, Florida could buy your school system for what it's spending on private school vouchers right now. That's astonishing. To me, is astonishing. What's equally astonishing, or I should say troubling, not astonishing, troubling, is that Florida ranks 44. They have $2 billion. They have enough money to buy your school system on the side. And yet their own public school system funding ranks 44th in the nation. And of those dollars that Florida spends on its public schools, the way that it distributes them, low funding, high need districts versus low need districts, ranks 37th in the nation. All right. So I would put to you that Florida isn't, so there's something perverse happening, which is there's all this conversation about meeting the needs of parental choice. Right. And I'm not, trying to denigrate or object to what parents think is best for their children. But what I am pointing out is that Florida, just like Nebraska, has a constitutional mandate to provide for its public schools. And it is discharging that mandate at 44th in the nation while it is spending billions of dollars on private schools. All right. That seems entirely contrary to those ideas articulated by our founding fathers that I discussed earlier. Now, Arizona, a more recent entrant to this field, right, just 2 years ahead of you, they got their voucher bill through. They said, this won't be a big deal, guys. We project in year one, sorry, the numbers are so small. We project in year one, this will cost $33 million. Million here, million there, don't worry about it. You guys are 10 million, right? Million here, million, don't worry about it. And we'll spend a little bit more the next year because more people are going to be interested. So in year two, we estimate 65 million. And when the bills came due last year, the bill was $332 million. How did that happen? It happened because unlike public schools, which get an appropriation each year that cannot be exceeded lest, someone get in big trouble, blank checks were written. Blank checks were written for vouchers in Arizona, unlike the public schools, right? And so rather than 65 million, they were 332 million. That projection, when that bill first passed, was, well, year 3, it'll creep up a little bit more. It'll go to 125 billion. Now we're talking big bucks. But based upon the most recent updated information, it is not going to be 125 million. It is going to be 429 million. This is not unusual, right? This is Wisconsin, Louisiana, Ohio, Florida, Indiana, Georgia, Arizona, every one of them doubling, tripling. I don't even know what the word is for 1,346% over your projected budget. I just more simply could say that is not fiscal responsibility. Some people say, oh, Derek, he's frothing at the mouth. You know, he gives a pass for all these failing public schools. I don't care what you think about public schools or don't. If you are a person of fiscal accountability, this is a serious problem. Let's back up to Arizona again. Arizona had a 1.3 or $4 billion budget shortfall last year. Well, how'd that happen? Because they're writing blank checks to things like vouchers, right? I don't think that's what taxpayers want done with their money. Now, then there's a substantive problem, and again, happy to take questions later, which is, okay, well, that's the fiscal accountability, that's the constitutional duty, but maybe this is good for students, right? That's a question. Some say, number one, I didn't put test scores up here, but the data doesn't bear out that student achievement test scores go up as a result of vouchers. In fact, quite the opposite. In fact, a lot of students move backwards during those first 3 years and then play catch up in the fourth. There's also tremendous amount of qualitative differences. I don't know what the finest private school here in Lincoln or elsewhere is. And a lot of times when these bills get passed, there's just some sort of like vision in someone's mind that all the poor children in the state are going to be admitted to Heathwood Hall. That's our great one in Columbia. It's like, no, Heathwood Hall is not trying to take vouchers. Heathwood Hall is not interested in vouchers. It's at least in South Carolina, it's the startup company on the side of the road that's interested in vouchers. And I'm not being anti-religious. I just want to make a factual statement. It's the small church with limited resources that wants to have its own school that's interested in vouchers, not Heathwood Hall, right? And to be clear, these programs do not require that any of these schools change any of their admissions policies. So they can pick and choose who they want based upon their academic credentials. And if you're Heathwood Hall, who do you want? You want kids you think are going to make 1,300 on the SAT, 14. You don't want a kid who needs remedial education, and they can say no, and they do say no. So they are not pulling out, right, the average student. There's also issues with special education. We could spend a lot of time on that, but children are in fact, some of the states require children to waive their rights under federal law regarding special education services when they enroll in these programs. And then there's anti-discrimination, or I should say absence of anti-discrimination in these programs. Of course, the state says we will give a voucher to any kid who wants it, but the kid who receives one is not able to attend any school he or she wants, right? That based upon their religion, based upon their sex, based upon their disability, based upon other, they may not be admitted. So what we really have are systems that create opportunity for some students, but not all, right? And that is the legislator's fault, because they don't demand that the institutions receiving these monies provide non-discriminatory treatment to the students that they take. And then finally, it's also worth noting, and most of this research comes out of Florida, that the textbooks that some of, not Heathwood Hall, I'm not worried about Heathwood Hall or your version here in Lincoln, but a lot of these schools, the textbooks are, I guess we might say, scientifically invalid, questionable as to their racial perspective, and for those reasons, and we could go into more, again, how is this an expense that serves the public? The sort of funding of an education that doesn't promote common values, that doesn't promote a common history or a common understanding of science, but does quite the opposite. Well, that's enough about vouchers. I could talk about that all day long. Another issue I think worth noting here in the state is what percentage of the total education bill is the state legislature picking up? Nationally, the average is 46, and I would say 46% is actually too low for reasons that I'll get into in a moment. This is 2021 data. At this point in time, I think Nebraska's was 31% of the total amount. So 31 as opposed to 46. My understanding that the state put another $300 million into the funding formula. Since then, I plugged those numbers in real quick with what we might call lawyer's math, and that told me, I think that's the same math as others, but maybe I left out a few steps, that jumped the state percentage contribution to 36%. So a very meaningful and important jump, but still short of the national average, and a national average which I would suggest to you is too low. Why is 46% too low? It's not always too low, but why is it a problem? So this is a chart which you can't make heads or tails of. I didn't make it bright or big enough, I suppose. But the basic point here, this is from an article that I published a few years ago that it took the percentage of each of the 50 states, what percentage of the bill do they pick up, and what is the funding gap between high poverty and low poverty districts in that state. It is not a perfect correlation, but on average, right, what you see is that the larger the percentage of money that the state pays, the smaller the funding gap between high need and low need states. That's not true everywhere. Again, that's not true everywhere. You can make schools unequal and the state covers 76% of the bill. There are some states that do that, but on average, that gap gets smaller as it gets larger. So that's, I think, something worth noting with Nebraska's being below the national average. Another thing worth noting, and I'll say again, this is with a little bit of common decency. I think your legislature did exercise some common decency on this point. Not perfect, but common decency. So in the decade following the Great Recession, the estimated amount of dollars lost from public education budgets was $600 billion nationally. How did this happen? Well, number one, all state and local revenues fell during the recession, and that caused a cutback and lowering of expenditures on public education. But tax revenues rebounded by 2012. Right, so they were back even to where they were before the recession, but public education revenues did not rebound. That states cut those dollars at the beginning of the recession and did not replace them. In fact, what you see, what you see over here to the left is that the orange line is state revenues going pretty steadily up, actually, or I should say it's state GDP starting to rebound, but that the education revenues sank and stayed low past 2012, came up at a much slower clip, and still haven't fully rebounded. So when you sort of take those into account and see, look, states are now, as a percentage of their GDP, spending less on public education than they did before. That's where the $600 billion of lost education revenue comes from. Now, I pulled Nebraska out here on this chart, and this is just looking at that 10-year period, 08 to 18. There was a 3% reduction in effort, which came out to a loss of 146 million. So, I don't know, I don't have the capacity with my lawyer math to figure out what that 300 million coming back in more recently does to that. May have closed the gap completely, but that's not to say that they were exerting enough effort to begin with, right? This is just saying putting money back that was lost. So important to up that effort level. And then how do we spend, or how does Nebraska spend the money that it has? Now, this was actually a little bit surprising to me. Maybe it was my own prejudices, but in 2020, Nebraska actually looked really good on this chart. So the general rough estimate, and it's not to say that it is the correct number, but the rough estimate is that lower income students require 40% more resources than their peers to achieve adequate education outcomes. And we've got different numbers for students with disability and ELL students. ELL students normally pegged at at 20%. But if we take that and roughly apply it up here, you would say, well, look, if you're meeting or coming close to meeting student need, you would need to be spending 140% or 40% more in these high need districts than others. In 2020, Nebraska looked pretty good on that. Nebraska was 34, I think that's, yeah, 34. If I had my glasses on, I could see over there, but 34%. And so that's pretty good. That's close to the 40%. But that number falls in half in 2021. I'm not sure exactly what happened in the formula, but goes from really being a high flyer to cutting that number in half down to 17 or so, which is again, to be fair, better than what 35 other states in America are doing, but well short of what students, needy students, need to achieve average outcomes. And depending on how that $300 million went in, and I think, at least what I've heard, it may have went into the formula in such a way that I expect this number to actually go down, which is to say that, Nebraska may be at 10% or 15%. We'll see. I will wait for the next report. This is by the Education Law Center. But so good, Nebraska exerts more effort, but if you exert more effort without distributing it correctly, then you may create problems, or you do create problems on this chart. So what does all this mean, to try to sort of bring it together? Is a perfect storm brewing in Nebraska? I can tell you there's a perfect storm that has brewed in a lot of other states, North Carolina, Florida, Ohio, and elsewhere, that is ravaging the public school system. Falling revenues, falling effort for public schools, and hundreds of millions of dollars going out the door to private schools. You're on the front end of that. You have a legislature that seems to maybe think, I don't know, maybe think that it can do two things at the same time. That maybe it can make additional efforts in public schools and increase funding at the same time that it creates voucher programs. I can't say that's impossible. I can tell you there's no other example of that in the United States of America. There's no other example of that in the United States of America. So we'll see, or you'll see, and then I'll come back and you'll tell me about it. So it's something to certainly be cognizant of, and I think it's especially cognizant of it in a state like Nebraska when you think about the demographics. Now, you just received an incredible shot in the arm, as far as I'm concerned, and the good work of, I'm sure, tons of people in this room to get a repeal on the ballot. No voucher has ever when put to the voters, no voucher provision has ever succeeded in the United States of America. They thought they had it in the bag in Arizona. And they even wrote it in such a confusing way that people didn't know. A lot of people originally were not sure when they voted yes. Yes meant no to vouchers. Yes didn't mean yes to vouchers, right? Or something. I don't know. I'm confused still now. All I can tell you is that a lot of hardworking teachers got out there and pounded the pavement to educate voters, and they rejected them by a vote of 65 to 35 in Arizona. It didn't go to a statewide ballot, but in 2018, a massive voucher bill flew through the Senate. No one knew anything about it. They were all happy about it, and I guess one of Texas's favorite senators came from Washington to gloat a bit, and they thought they had it. And then, but it had to go to the House. And those small rural communities in Texas, West Texas, and I drove through West Texas this spring. I tell you what, I doubt Nebraska got anything on West Texas, to be quite honest. That is the most sparsely populated place I've ever been, and a nice place. But I'm like, how do they run school system out here with so few people? That level of rurality. And those folks in the rural communities, when they heard about it, they got on the buses and they descended on Austin. And they had a question to ask, which is, what does a voucher bill have anything to do with the fact that we have not laid a new brick? We have not hired a new teacher, or at least we haven't had a fully staffed school. We haven't had a new bus in a decade. What does any of this have to do with all of the communities spread across Texas? I'm sure that's the same question for a lot of communities in Nebraska. And I tell states like this, and I tell my own home state, you know, don't go to Columbia. That's our cap. Don't go to Columbia and fuss about vouchers. Don't go to the largest district. We know why they're mad. Go to your rural communities and ask them why it is that their representative is so worried about pushing through bills that have nothing to do with their community. There's no private schools in these rural communities. The only private school that's coming to these rural communities is an out-of-state corporation that wants to provide them online education. And many of us, unfortunately, saw exactly how that worked during the pandemic. I don't think we want to go there. So in any event, right, I think it's unfortunate we have to put in the hard work, but I'm confident that particularly your rural communities will see it that way. And then finally, I'll say, look, you know, state's moving in the right direction in some respects, but there's a better mix of funding that can be distributed, I believe, in the state of Nebraska to meet, you know, Nebraska looked really good in 2020. I think moving back in that direction is very important for meeting the needs of the student. And I think the effort level and the percentage of money coming from Omaha is really the only way that you solve that problem. So with that, I'll say you've got a perfect storm, and it's a little ways out there. And if you can keep it at bay, you know, I think you'll do a great service to everyone in the state. And happy to take questions if there are any. Thank you.
Hello, thank you so much. I have a lot of questions, but I'm going to just ask one. In your opinion, what is the why behind the push for vouchers? We see it doesn't work. We see I mean, of course, the folks in this room feel that way, but from the people who are pushing it, what do you think the main agenda is? Is it to completely defund public schools? And what can we do to continue to push back against those that are moving in that direction?
Yeah, I think the why, so one of my colleagues just has a great book just came out, Josh Cohen, called The Privateers, which talks about this, but maybe it doesn't have all the story. I think what's happened is that there are at least two or three different constituencies here. So the original constituency for vouchers were poor and low income Black children in large cities. At least that's what people thought they were. And when those communities got choice in a different form, charters, and I'm not saying charters are good or bad, they said, we don't need that. Like, we remember Brown versus Board. We remember the state of Virginia saying they were going to close public schools across the state and have vouchers so that white kids could keep going to school with white kids and Black kids keep going to school with Black kids, notwithstanding Brown versus Board. We're not interested in that. So that didn't pan out, right? Sort of thinking the Black community was going to carry that torch. Now, certainly, you know, in Columbia, if you go to a hearing, you would think that no white child wants a voucher and every Black child in the state does, because that's sort of how they situate the room when the hearings start. And certainly there are communities of color who do want them. But there's the other constituency, which is a religious constituency, right? There's this sort of belief going back to my childhood and others that the Supreme Court made the schools anti-religious, you know, with school prayer and other sort of bans and that sort of thing. And that, you know, that the schools are morally corrupt, right? So you have a religious community that believes they need freedom for religious reasons. And so, you know, I'm not going to second guess people's religion, but there's that. But that constituency by itself is not big enough either, right? They thought Black kids and those interests together might be enough Black kids left not having it. And then you have what I call the anti-big government, sort of don't like big government crowd, which is if you don't like big government at the federal level, that means you don't like Medicare and you don't like Social Security. If you don't like big government, I mean, we don't call public schools big, but if you don't like big government at the local level, or if you just don't want to pay taxes, then public schools are the biggest line item that states spend. And so you've got, you know, I mean, and that was the Koch brothers who funded a lot of these, you know, sort of agendas across the state. Just said, look, we think people should take care of themselves and not tax people. So you've got that constituency that's moved it forward. And that constituency has been quite powerful because they've used sort of the other folks as sort of leaders in that. But I think then you've also got the sort of the privateers who want to make money. I mean, if it is the biggest, like, why do we spend so much on, you know, warplanes? Because, you know, Boeing makes them, you know, or whoever, Lockheed Martin. Lockheed Martin spends a lot of money, you know, lobbying for that. So there are private interests that stand to make a lot of money. And that's not a criticism of the military, but there's a financial incentive. So you've got a lot of different communities coming together and spending a lot of money. And then I guess finally you have this sort of, it became a cultural litmus test after COVID. And that's what really put it ahead. I mean, Betsy DeVos spent 3.5 years begging Congress, begging states to pass vouchers, and she got nowhere. But after January 6th, it became the litmus test. Are you for or against vouchers? So just like that, it just sort of, it became this sort of lightning rod issue. And of course, that was bound up in critical race theory and mask and all of those things. So, so you have a lot of different constituencies coming together, spending a lot of money in state houses. You know, people don't want it so much, but people in the state house are willing to spend money on it. Other questions? Yes. Yeah, so in some states they've been, so I should say, Kentucky Supreme Court struck down a voucher program about 1.5 years ago. South Carolina has struck one down twice. There was initially a lower court struck one down in Tennessee, and then it got sort of reinstated. Supreme Court in Nevada, about 4 or 5 years, struck one down. Florida Supreme Court struck one down. But then you have these other courts that have said, well, look, and I get nervous about telling legislatures how they could, you know, navigate and get this done. It's like, I'm not trying to advise them how to do it, but, you know, they come up with strategies and backdoor ways, what we call education savings accounts and tax credits, to be able to achieve the same objective without it being a direct transfer out of the Treasury into the private school. So it's still the same thing. It's still the same amount of money. It's still going to the same place, but it goes through a more circuitous route. And in fact, our state thought they had found one circuitous enough to avoid constitutional scrutiny. And our state Supreme Court said, no, not quite, you know, a little bit too cute. So, but other states have been willing to say, well, you know, that route is different. So I think that's some Supreme Courts just kind of bending to the political will of the states. There's these other no aid provisions, I'll say quickly, that only target religious institutions, and those are now unconstitutional. United States Supreme Court said, look, you can bar public funds to private schools, but you can't bar public funds only to private religious schools, right? That's religious discrimination. And so the states that have that, their provisions are no longer enforceable. I think it's probably the last one here. I'm seeing they're about to run me off the stage. Or you're hungry, probably, too.
We have noticed in the past few years when a petition or an initiative has passed by the people that our legislature will be slow to actually implement that. Maybe, I think even to the point of having to, I think litigation, I can't remember if I'm right about that. But so I'm a little concerned that if this this question on the ballot to repeal what we currently have, is it possible that the legislature could then be slow to actually repeal?
I don't want to get too far over my skis, but I would think with this particular provision, my guess, and I'm going to emphasize guess being on there, is that issue is not an issue, because what you're really doing is telling them to stop doing a thing. So like if the provision or the repeal happens and there's no other sort of legal problems with it, you could immediately enjoin a state officer from sending those monies out. The bigger problem has been, like, so in Colorado, they passed a provision like 15 years ago mandating that public education budgets increase by X% every year with inflation. It's very easy to make a legislator stop doing something, but when they actually have to affirmatively do something, that means they have to pass legislation, and courts cannot make legislators pass legislation. But this referendum, as I understand it, doesn't require legislation. It requires executive officers to not do a thing, and that's a lot easier to enforce. Thank you.
So please, a round of applause again for Professor Derek Black. Thank you. Well, we have made it to the end of our program. So thank you so much for being here. And I just want to take a moment to say thank you again to all of our panelists, our speakers who joined us on the stage today. And I also want to take a moment just to thank the team at OpenSky who've put this program together. So if you work at OpenSky, can you please stand up or wave to be acknowledged? We are a small but mighty team, but I always say teamwork makes the dream work, and then they all roll their eyes at me. We invite your thoughts on this about the symposium in a survey going forward that we will be sharing with everyone who registered. As you know, we love data, and your input is important to us as we at OpenSky work to make policy discussions more accessible and easier to understand for everyone in the state. So please look out for that link, and thank you for your input in advance. We invite you to spend some time with some of our publications, which are over on a table here. We'll have a few more publications coming out later this year on some key policy issues in the state. And finally, if you enjoyed our symposium today, we hope that you'll consider supporting OpenSky's work. We have envelopes on the table. There are QR codes in your program. We can't bring you high quality evidence and an analysis without our community supporters. So thank you to the many of you in the room today who have supported OpenSky directly. We are so grateful for you and what you do to help us do the work that we're doing. If you haven't donated to OpenSky yet, we also hope that you will join our community today, and you can do that through that QR code. We appreciate your support. Thank you for sharing your time and your insights today. I encourage everyone to continue the dialogue that we started today, as this exchange of ideas and collective action are key to meaningful change and the good life for anyone in our state. So thank you so much.